Okay, thank you all for coming, and I want to thank our panelists for what is going to be a very important hearing. The rules will be that I will make some opening remarks. Senator Burr, the ranking member, will make some opening remarks. Members will have 3 minutes, and I will keep people to 3 minutes because it's going to be a long hearing. We're then going to go to Secretary Shinseki and Undersecretary Petzel. We have an excellent second panel made up of service organizations. We look forward to hearing from them. We have a very good third panel as well. So it's going to be a long hearing, and we're going to get through it. Let me begin by just making a few basic points. Very serious allegations have been made about VA personnel and their doings in Phoenix and in other locations. I take these allegations very seriously, as I know every member of this committee does, which is why I have supported an independent investigation by the VA Inspector General. As we speak right now, the Inspector General's office is in Phoenix doing a thorough examination of the allegations, and my hope is that their report to us will be done as soon as possible. And what I have stated and repeat right now is that as soon as that report is done, this committee will hold hearings to see what we learn from that report and how we go forward, as soon as we possibly can after their investigation is completed. I think there is no member of this committee who disagrees, and nobody in the United States, that this country has a moral obligation to provide the best quality care possible to those who have put their lives on the line to defend this nation. And I believe that every member of this committee will do everything that we can to get to the truth of these allegations. But if we're going to do our job in a proper and responsible way, we need to get the facts and not rush to judgment. And one of the concerns that I have, to be very honest, is there has been a little bit of a rush to judgment. What happened in Phoenix? Well, the truth is we don't know, but we are going to find out. Now, let me say a word about VA healthcare in general, which is what this hearing is about. What we want to know about VA healthcare is what is going well and what is not going well. And in terms of what is not going well, how do we improve that? Today, we must understand that when we talk about VA healthcare, we are talking about the largest integrated healthcare system in the United States of America. VA has 150 medical centers, has over 800 community-based outreach clinics, and some 300 vet centers. Every year, the VA is serving 6.5 million veterans. Today, tomorrow, and next week, every single day, VA serves more than 200,000 veterans every single day. Now, what does that mean? And here's my point. If Senator Burr and I were to run around the country and visit every VA medical center, this is, I suspect, what we'd find. You'd find people coming out and they'd say, I got pretty good health care. I like my doctor. I was treated courteously. And then we would find people say, you know what? I had a bad experience. I didn't like my doctor. The point that I want to make is that when you are dealing with 200,000 people, if you did better than any other health institution in the world, there would be thousands of people every single day who would say, I don't like what I'm getting. And we have to put all of that in the context of the size of VA. Does VA in general provide good quality care to veterans? Simple question. The answer is that some people think that it provides very good quality care. The American Customer Satisfaction Index ranks VA's customer satisfaction among veterans patients among the best in the country. And if you go out and you talk to veterans, generally speaking, I tell you in Vermont, not 100%, people say, yeah, we get pretty good health care. Not perfect. Are there problems? Absolutely. And we're going to talk about those problems. The National Commander of the Disabled American Veterans, and these are folks who are dealing with people who have service-connected injuries, people who were hurt in war, said this before the committee in February, and I quote, "Across the nation, VA is a model healthcare provider that has led the way in various areas of biomedical research, specialized services, graduate medical education and training for all health professions, and the use of technology to improve healthcare." DAV went on to say, "Such quality and expertise on veteran-specific health needs cannot be adequately replicated in the private sector." The Paralyzed Veterans of America today will testify, and I quote, "The simple truth is the VA is the best healthcare provider for veterans. In fact, VA's specialized services are incomparable resources that often cannot be duplicated in the private sector." Today, the president of the National Association of State Directors of Veterans Affairs, representing all 50 states, will tell us, quote, "The state of VA healthcare in our nation is strong." Further, and here's another point that has to be made, and I know that it doesn't fit within a 12-second soundbite, but this is a point that has to be made. There is no question to my mind that VA healthcare has problems, serious problems. But it is not the case that the rest of healthcare in America is just wonderful. Everybody walks in, gets immediate care, gets great care at no cost. It's all affordable. That's not the world we live in. And let me give you one example of that, because it is important to put VA healthcare in context. A Scientific American article, September 20th, 2013, less than a year ago, states, quote, "How many die from medical mistakes in U.S. hospitals? An updated estimate says it could be at least 210,000 patients a year, more than twice the number in a frequently quoted Institute of Medicine report. Hospital errors that cause death are now the third leading cause of death in America behind cancer and heart disease." What does that mean? Have deaths been reported through medical errors in the VA? The answer is yes. And every one of those deaths is a shame and something that we have got to address. But it's not just the VA. Third leading cause of death in America are medical errors in hospitals. That's an issue we have to address. Now, having said all of that, trying to put this debate in a context, there is no doubt in my mind that there are serious problems facing VA healthcare, and we have got to do everything that we can to address those problems. Let me just discuss a few. Does the VA have adequate staffing? When we talk about patient wait times, which is a major, major concern in certain parts of the country, and this issue just came up the other day in Phoenix, where a town meeting was held by the American Legion. The issue of wait times came up. Is the VA adequately staffed? Do we have enough doctors and nurses in various parts of the country? I don't know the answer to that, and that I want to find out. Further, is the VA doing a good job in allocating its resources to where the staffing is needed most? There are some places in the United States where VA load is going down, fewer people are coming in, other places where it is increasing. Are we allocating resources appropriately? And let's remember that in the midst of all of that, we are dealing with 200,000 men and women who have come back from Iraq and Afghanistan with PTSD and TBI, not easy problems to address. A few years ago, VA changed their wait time measure to an ambitious 14 days. If you call up, you're going to get in 14 days. Was that appropriate? Can they accommodate that with the level of staffing that they have? We need to discuss that. And what happens to those facilities that are unable, in fact, to bring patients in within the 14-day period? Is it possible that in some cases, unrealistic expectations have created a situation where some staff is, in fact, cooking the books? I want to look at that. So with that, I look forward to this hearing to get at the root of some of the healthcare problems facing the VA. And with that, I want to give the mic to Ranking Member Senator Burr.
Thank you, Mr. Chairman. Thank you for calling this hearing. Secretary Shinseki, welcome. And to all the other witnesses today, thank you for your willingness to be here with us. The issue before the committee today is the state of VA healthcare system, which we have a sacred obligation to ensure that those who have fought for this nation receive the highest quality of services from the Department of Veterans Affairs. Now, in the chairman's opening remarks, he was correct. We're not here to analyze a poll that was taken about the VA, but we are here rather to look at the investigations that have already taken place and addressed certain deficiencies within the veterans system that no action was taken on, or at least not corrective action. In fiscal year 2013, VA reported that 93% of specialty and primary care appointments and 95% of mental health appointments were made within the 14 days of the patient's or provider's desired date. At first glance, these numbers appear to demonstrate that veterans are receiving the care they want when they want it. However, we know this is not the case. I think if VA had asked hard questions regarding these statistics, we would not be here today discussing recent allegations surrounding many, and I stress many, VA facilities. More specifically, we're here to discuss today when senior leadership in the department became aware that local VA employees were manipulating wait times to show that veterans do not wait at all for care. It seems that every day that there are new allegations regarding inappropriate scheduling practices ranging from zeroing out patient wait times to scheduling patients in clinics that don't even exist, and even to booking multiple patients for a single appointment. The recent allegations were not only reported by the media, but have even been substantiated by the General Accounting Office, the Inspector General's Office, and the Office of Medical Inspector. Here are a few examples. The GAO released a report on the reliability of reported outpatient medical appointment wait times and scheduling oversight in December 2012 and has testified multiple times on this issue. Several IG reports have been issued regarding delays in care and scheduling irregularities, including reports on Temple, Texas in January 2012, and up to the most recent and egregious report in September 2013 at the Columbia VA Medical Center. Two publicly released Office of Medical Inspector reports related to whistleblower allegations at Jackson VA Medical Center and the Fort Collins community-based outpatient clinics. Even more troubling is that with the numerous GAO, IG, and Office of Medical Inspector reports that have been released, VA senior leadership, including the Secretary, should have been aware that VA was facing a national scheduling crisis. VA's leadership has either failed to connect the dots or failed to address this ongoing crisis, which has resulted in patient harm and inpatient death. The question we must answer today is, even with all the information available to the Secretary starting over a year and a half ago, and specific instances of patient harm and death directly related to delays in care, why were the national audits and statements of concern from the VA only made this month? I thank the Chair. I yield back.
Thank you, Senator Burr. Senator Murray.
Well, thank you very much, Mr. Chairman. I'm really glad you called this hearings. Like most Americans, I believe that when it comes to caring for our nation's heroes, we cannot accept anything less than excellence. The government made a promise to the men and women who answered the call of duty, and one of the most important ways we uphold that is by making sure our veterans can access the health care they need and deserve. So while the department generally offers very high-quality health care and does many things as well as or better than the private sector, I am very frustrated to be here once again talking about some deeply disturbing issues and allegations. It's extremely disappointing that the department has repeatedly failed to address wait times for health care. So I was encouraged when you announced a nationwide review of access to care, and I'm pleased that the President is sending one of his key advisors, Rob Neighbors, to assist in overseeing and evaluating that review. His perspective from outside the department will make this review more credible and more effective. But announcing this review is just the first step. These recent allegations are not new issues. They are deep, system-wide problems, and they grow more concerning every day. When the Inspector General's report is issued and when the Access Review's report is given, I expect the Department to take them very seriously and to take all appropriate steps to implement their recommendations. But there are also cases where the facts are in right now. There are problems we know exist, and there is no reason for the Department to wait until the Phoenix report comes back before acting on the larger problem. The GAO reported on VA's failures with wait times at least as far back as the year 2000. Last Congress, we did a great deal of work around wait times, particularly for mental health care. The Inspector General looked at these problems in 2005, 2007, and again in 2012. Each time, they found schedulers across the country were not following VA policy. They also found in 2012 that VA has no reliable or accurate way of knowing if they are providing timely access to mental health care. But now the IG recommendations are still open, and the Department still has not implemented legislation I authored to improve this situation. Clearly, this problem has gone on far too long. It is unfortunate that these leadership failures have dramatically shaken many veterans' confidence in this system. Secretary Shinseki, I continue to believe that you take this seriously and want to do the right thing. But we've come to the point where we need more than good intentions. What we need now is decisive action to restore veterans' confidence in the VA, to create a culture of transparency and accountability, and to change these system-wide, years-long problems. This needs to be a wake-up call for the Department. The lack of transparency and the lack of accountability is inexcusable and cannot continue on. The practices of intimidation and cover-ups has to change starting today. Giving bonuses to hospital directors for running a system that places priority on gaming the system and keeping their numbers down rather than provide care to veterans has to come to an end. But, Mr. Secretary, it can't end with just dealing with a few bad actors or putting a handful of your employees on leave. It has to go much further and lead to system-wide change. You must lead the Department to a place where we prioritize the care our veterans receive above everything else. The culture at the VA must allow people to admit where there are problems and ask for help from the hospital leadership, from the VISN leadership, or from you. This is the time to make real changes. Thank you, Mr. Chairman.
Thank you, Senator Murray. Senator Isaacson.
Well, thank you for the call on the hearing, Mr. Chairman. Mr. Chairman, I'd like to ask unanimous consent that the complete statement of Senator John Bozeman be entered for the record.
Without objection.
And also our best wishes for the committee for his speedy recovery from
Absolutely.
Mr. Chairman, could I ask unanimous consent that all members' opening statements be included in the record?
Of course.
Dr. Petzl, Secretary Shinseki, thank you for being here today. The chairman has said we should not rush to judgment, and that's always true, but we should have a rush to accountability. Even before Phoenix, even before Durham, even before some of the other Cheyenne, Fort Collins, the others that have come to matter, we've already known, and the VA has admitted to at least 23 deaths that took place in part because of delays in GI consults. 7 of those were in my area, 2 in North Florida, 3 in Augusta, Georgia, 4 in Atlanta, Georgia, at the VA hospital in Atlanta, Georgia, all mental health issues. Dr. Petzl was in my state on August the 22nd of last year for a 2.5-hour hearing on the Atlanta situation. And we knew and determined then that it was problems with delays in setting appointments for mental health patients that caused an open period of time where, in fact, they took their life because of a failure to get the services they should have gotten. So while we need to complete the IG's report and find out every problem where things are wrong, we've had 50 IG reports since 2013. And in those reports, we found repeatedly over and over again where there has been a gaming of the system, where the system is more important than the patient. I think our veterans, and I think you, Secretary Shinseki, deserve better from the members of the Veterans Administration and the VA health system. I told you yesterday on the phone when you were generous enough to call and we had a long discussion, I think the veterans and yourself have been misserved by the senior management of the VA. We need accountability. What's going on in the VA is not a mystery anymore. We'll find out more from the IG's report. But I would hope we'd get an accountability in the chain of command at the VA as in the accountability of the chain of command in the United States Air Force when I was in the service, where you're held accountable for your responsibility. Mistakes are not tolerated. One mistake might be tolerated, but the second mistake on the same decision should never be tolerated. I thank you for being here today. On behalf of all the veterans in Georgia and in the United States of America, let's get this right. Let's hold the system accountable. Let's make sure that no veteran dies because of a failure of the system to see to it they get appointments for the care they need when they need it. I yield back.
Thank you, Senator Isaacson. Senator Blumenthal.
Thank you, Mr. Chairman, and thank you very, very much for holding this hearing, which I hope and believe will be bipartisan and as non-political as it possibly can be. Let me thank you, Secretary Shinseki, for your service to our nation. Over many years, you have served and sacrificed for this nation, and I deeply respect and thank you for all that you have given to the United States of America, including in your 6 years as Secretary of the VA. And I know that you are determined, as the President is determined, to unravel and reveal any wrongdoing, to remedy any damage, and to restore trust and confidence in the VA healthcare system. And I agree with the Chairman that we should avoid a rush to judgment. But we have more than allegations at this point. We have evidence, solid evidence of wrongdoing within the VA system, and it is more than an isolated instance of wrongdoing. It's a pattern and practice, apparently, of manipulating lists and gaming the system, in effect cooking the books, creating false records, which is not just an impropriety or misconduct, it is potentially a criminal act. And it is a pattern, as the chart submitted by the American Legion as Addendum C shows. There is a pattern across the country in more than 10 states of this misconduct occurring. In addition, there is a history. The GAO has reported, your own Inspector General has reported these kinds of problems in the past. So there is a need now for more than just investigation. There's a need for action to restore trust and confidence, to assure accountability and transparency. Our nation's veterans deserve the best medical care, nothing less. The situation now, presenting serious, pressing, unanswered allegations and uncertainty, is intolerable. And I have very severe and grave doubts that the resources now at the disposal of the Inspector General are sufficient to meet this challenge. I think there is a need for more than just the kind of appointment that the President has made of Rob Nabors to oversee the Department of Veterans Affairs investigation. There's a need for resources going to the Inspector General and possibly involvement of other investigative agencies from the federal government, because the resources currently available to the Inspector General simply may be insufficient. In addition, there are 3,000 job openings across the country in the VA. They're listed on usajobs.gov. I urge that positions relevant to access to medical care be filled immediately, and that action be taken to restore not only the transparency and accountability that we all expect from the VA, but also to deal with the disability claims backlogs that continue to plague the VA. The question now is, what does the evidence show? Is it criminal or simply civil? And that judgment has to be made as soon as possible. Thank you, Mr. Chairman.
Thank you, Senator Blumenthal. Senator Heller.
Thank you, Mr. Chairman, and Ranking Member Burr for holding this hearing today. I want to thank the Secretary and Dr. Petzel for also being here. The other witnesses, thank you for taking time to be with us today, and also for the veterans that are in the room with us today, those that may be watching this hearing. Thank you very much for your service. What has come to light about the VA in recent months has proven to Congress, to veterans, and to the American people that there's a real problem with accountability at all levels within the Veterans Administration. Poor management and care from the VA is also a problem that Nevada veterans are facing, and it's not something that is new, and in fact, it's something I've raised repeatedly with the VA to no avail. I believe it's long overdue for this committee to exert its oversight and hold leadership within the VA accountable. Just last week, I sent a letter to Senator Shinseki asking for immediate answers about the lack of accountability on the local level and whether the VA leadership finally plans to do something about it. I look forward to receiving a timely response and action on the concerns that I highlighted. As Nevada's representative on this committee, I believe it's also my role and responsible to get answers for Nevada's veterans about the problems that they're facing with VA care and benefits. In Las Vegas, veterans have complained of excess wait times in the emergency room, which in itself is too small to meet demand. Just a month ago, the VA Inspector General investigated the VA's treatment of a blind female veteran who waited over 5 hours in the emergency room and later, 2 weeks later, died. The IG also found that a quarter of the veterans in the emergency room wait over 6 hours before receiving care. Furthermore, a Las Vegas veteran wrote me a letter recently, and said he had to find care elsewhere because the wait time for an appointment at the VA was longer than 2 months. Given these concerns, as the VA completes its face-to-face audits of VA facilities, I want assurance that all of Nevada's VA medical centers and clinics will be thoroughly audited and that I will receive and be able to review the results immediately. As the co-chair of the VA Backlog Working Group, I'm also extremely concerned with the claims backlog in Nevada. Although the Secretary promised me that there would be changes, Nevada veterans are still waiting the longest, at 355 days on average, for their claims to be processed. When my office then requested the status of veterans' claims, the Reno Varro is unresponsive. It's unacceptable that local VA officials would limit any congressional office's ability to get answers for their veterans. Despite my repeated requests, these ongoing issues have not been resolved. At some point, I have to ask if these problems in Nevada are the demonstration of failed leadership at the top. VA leadership is not holding local officials accountable and is failing to care for those who sacrifice on our behalf. Promises to change and do better for our veterans have not produced results. I want changes. I do not want empty promises. If the VA continues on this course, I think it's ultimately time to look to the top for these changes. Thank you, Mr. Chairman.
Thank you, Senator Heller. Senator Hirono.
Thank you, Chairman Sanders, for providing this forum for us to drill down on the root of the many issues facing veterans hospitals and finding solutions to these problems. I certainly echo the sentiments of my colleagues in expressing concerns regarding the VA culture, the lack of enough accountability, the probable need for structural and system-wide changes. The veterans healthcare system is a promise that we made to America's veterans that we will take care of them in return for their service and sacrifice. The close to 10 million veterans that access care through the VA system need to trust that they are receiving high-quality care when they need it. And I do note 10 million veterans signed up for the healthcare system is huge. That is greater than the population of a number of states, including the state of Hawaii. When we fail to provide proper care for our veterans, we not only fail them, but their families as well. And these families have also sacrificed for our nation's security and provide essential care and support for our veterans. And while the immediate focus may be on the Phoenix case and similar allegations regarding a number of other VA hospitals, it is important to see what is happening systematically at the VA to provide veterans high-quality care. And so we must look at the totality of the VA system to see what is working and what is not. I look forward to hearing from the panel about exactly what the challenges and problems are, what actions have been taken, need to be taken to serve our veterans better. And while the VA Inspector General is investigating and Secretary Shinseki has called for a national face-to-face audit of the VA health system, my hope is that this first of a number of hearings by this committee will identify other changes that should be implemented. I look forward to hearing from you once again, Mr. Secretary, and the other VA officials on your plans to resolve the underlying issues and restore confidence in the veteran community, and very importantly, to listen to what the veterans community has to say about the changes that need to be made. Thank you, Mr. Chairman.
Thank you, Senator Hirono. Senator Moran.
Mr. Chairman, thank you, and Senator Burr for conducting this hearing. Mr. Secretary, good morning. arrived a few minutes late this morning because I've just returned from the World War II Memorial, where a Kansas honor flight was there. Had conversations with Kansas veterans again this morning. It's a moving experience each and every time to have that opportunity to visit with our World War II veterans. And again, the conversation was the VA is failing them. Please make certain, Senator Moran, that that doesn't continue. Thousands of veterans across the country, but hundreds of veterans in Kansas visit with me on an ongoing basis, and they tell me they're struggling and suffering stories because of circumstances they find at the Department of Veterans Affairs. They would tell me that that the sacrifice that they encountered, if they were willing to say this less than humble sentence, they would say, "Why can't we have the service that we earned and deserved?" And the reality is they earned and deserved that service, and in my view, the Department of Veterans Affairs is not providing those worthy veterans what we have committed to do. The sad story is that many veterans across the country, and certainly in Kansas that I speak to, have lost hope in the Department of Veterans Affairs and just believe that things are never going to get any better. Your announcement of a face-to-face review across the system, Mr. Secretary, I find lacking in what needs to be done. The reality is that we have had review after review, Inspector General report after Inspector General report, questions by this committee and the House Veterans Affairs Committee that as a result, as far as I can tell, has resulted in no action by the Department of Veterans Affairs. The idea that you can conduct a system-wide, as you indicate in your opening testimony, review of the VA using 220 VA employees and visiting 153 medical facilities. Mr. Secretary, we have 1,700 VA points of access to care, and you indicate in your testimony this will provide a full understanding of the VA's scheduling policy and continued integrity in managing patient access to care. I don't see a review that lasts 2 weeks using 220 employees and looking at 153 medical facilities as capable of providing that information. So I would suggest this seems to me to be more damage control than it does to be solving the problem. I actually think that we don't have the need for more information, although that's always welcome. What we need is action based upon the information that has already been provided to the Department of Veterans Affairs. I've served 18 years on the Veterans Affairs Committee. I've worked with 9 Secretaries of Veterans Affairs, and what is seemingly true to me today is that the quality of service, the timeliness of that service is diminishing, not increasing, and that wasn't true until recently. We have a significant number of veterans that we serve today, but Mr. Secretary, we can anticipate more as our military men and women retire from service in Afghanistan and Iraq. We have an aging World War II veteran population. If we can't care for the veterans that we are trying to care for today, how do we expect the Department of Veterans Affairs to care for those as the numbers and seriousness of their condition increase? So, Mr. Secretary, I look forward to hearing what you have to say today. I welcome that conversation. But in my view, an additional review by your department is not the answer. The answer is action by the Department of Veterans Affairs that changes the system that you are leading and changes the culture and nature of the folks that are your employees. I look forward to your testimony. I look forward to making certain that we keep our commitment to those who served our country. Thank you.
Thank you, Senator Moran. Senator Begich.
Thank you very much, Mr. Chairman, for holding this meeting, Ranking Member Burr, for offering an opportunity to have this discussion and oversight of the VA and the issues that are surrounding the scheduling, but also many other issues that the VA faces. Let me first say to our 2 panelists, thank you for your service to this country in both your ways that you have done. But Secretary Shinseki, immediately after the Phoenix story broke, I sent a letter very quickly because I was outraged, unbelievable what I was hearing. But now, after a few weeks, it's now become a systematic issue that I've now seen in others, as you've indicated through your own conversations that I've had with you, that it seems to be an issue that is occurring in other VA clinics. I will say, from a state that has 77,000 veterans, the highest per capita in the nation, it is impactful in determining where they get their care. We've been fortunate, to be very frank with you, the work we've done with the VA to be able to create access to our Indian health care services that has been able to cut some of that wait time out, but get better service throughout the state. But when we look at veterans, may they be in Alaska today, tomorrow they might be in Arizona, tomorrow they might be in North Carolina. So the service that's being delivered is critical that we figure out the systematic problem. And I do agree with my colleagues here that We have report after report after report. I've been here now a little over 5 years, and all I've seen is GAO reports and other reports that always indicate systematic problems that we need to correct. So I am going to be anxious for your commentary as well as others on how we're going to fix this once and for all. And I know you've been burdened in some cases because we've had 2 wars, and the VA started to be funded aggressively in the last 3 or 4 years after we've already started to wind down in Iraq and now Afghanistan, which has caused a lot of pressure. So I need to understand how that's impacted some of the work of the VA. Also, as you look at the issues and you examine what we need to be doing, I want to know from your perspective, what are things that we're doing through more regulation or more laws that are creating more hurdles and red tape? If there's stuff that we should be eliminating to create a more streamlined process, I want to know that. But to not have the service delivered at the highest level to our veterans is a disservice. They earned it. They fought for this country. They served our country. We need to do everything we can to make sure the service is delivered at the highest possible level. So today will be a little contentious, no question about it. I hope tomorrow that we take what we've learned today and move to increase the capacity and increase the performance of the VA. I thank you both for being here, but I will tell you I was outraged and unbelievable what I'm now seeing over the last few weeks. But I'm anxious to work with you to get our veterans the best care possible, as we have started to do aggressively in Alaska in a very unique arrangement with our Indian Healthcare Services and the VA, which I think is delivering better care than ever before, but more work to be done. Thank you, Mr. Chairman.
Thank you, Senator Biggett. Senator Testa.
Yeah, thank you, Senator Sanders, and Mr. Chairman and the Ranking Member Burr for convening this hearing. I want to thank the witnesses for being here, this panel, and the next 2. You know, as an elected official, the most meaningful and most difficult decision I confront is a question of sending men and women into harm's way. And Montanans tend to list in high numbers. We have the 2nd highest per capita of veterans in our state. It's a very personal issue for me, and it's why I'm very proud to serve on this committee. And I'm encouraged that folks in Washington are suddenly interested in access to health care for veterans. In most cases, this is long overdue. Before I got here, the VA didn't even have mandatory funding. They certainly didn't have forward funding. So this is a topic that many of us have been trying to address for years. And given my close association with veterans issues, I'm approached by veterans every time I go home, and that is almost every weekend. And an overwhelming majority of those folks are appreciative of the care of VA in Montana. And when they have issues or concerns, they are not bashful, as veterans are not, about telling me about it. And when I get back to my office on Monday, I work on those concerns, often with you two. The allegations that they hear and the allegations that I am hearing now are very troubling. If any of these allegations in Phoenix or elsewhere turn out to be true, swift and appropriate action needs to happen. If the issues are systemic, we need to make some fundamental changes, and we need to make them now. If the issues are about employees' misconduct and competence, specific heads should roll. And now, in order to move forward effectively and smartly, we do need the facts. I hope we get those today, in part. And if we're truly interested in honoring our veterans by doing them right, the facts will drive a productive conversation about access to health care for our veterans. So let's talk about the ways we can address the VA medical workforce shortfalls, particularly in rural areas. Let's talk about ways we can improve transportation options for veterans or expanding telemedicine initiatives. Let's talk about buildings and partnerships between the VA's local providers and providing the VA with the resources it needs to address its patient workloads. Let's have these conversations so that we can provide veterans with meaningful action items, not just political talking points. Veterans deserve our best. They have sacrificed much. Let's demonstrate our best by having a productive, constructive, truthful conversation about what needs to be done to fix the problems that are out there in our VA. Thank you, Mr. Chairman.
Thank you, Senator Testa. Senator McCain of Arizona is not a member of this committee, but given that very serious allegations have been raised about treatment in Phoenix, Senator McCain requested to come before the committee, and we welcome him today. Senator.
I thank you, Mr. Chairman. I want to thank you for the opportunity to make a brief statement this morning, particularly given that many of the serious allegations that will be discussed at today's hearing involve the treatment of veterans in my home state of Arizona. Since our nation's founding, Americans have been fighting in faraway places to make this dangerous world safer for the rest of us. They've been brave, they've sacrificed and suffered. They bear wounds and more losses they will never completely recover from, and we can never fully compensate them for. But we can care for the injuries they suffered on our behalf and for their physical and emotional recovery from the battles they fought to protect us. Decent care for our veterans is the most solemn obligation a nation incurs, and we will be judged by God and history how well we discharge ours. That's why I'm deeply troubled by the recent allegations of gross mismanagement, fraud, and neglect at a growing number of Veterans Administration medical centers across the country. It's been more than a month since allegations that some 40 veterans died while waiting for care at the Phoenix VA were first made public. To date, the Obama administration has failed to respond in an effective manner. This has created in our veterans community a crisis of confidence toward the VA, the very agency that was established to care for them. At a town hall forum I hosted in Phoenix last week, the families of 4 veterans who passed away in recent months stood before a crowded room to tell their stories. With tears in their eyes, they described how their loved ones suffered because they were not provided the care they needed and deserved. They recalled countless unanswered phone calls and ignored messages, endless wait times, mountains of bureaucratic red tape, while their loved ones suffered debilitating and ultimately fatal conditions. No one should be treated this way in a country as great as ours. But treating those to whom we owe the most so callously, so ungratefully, is unconscionable, and we should all be ashamed. Since the initial reports in Arizona last month, we've seen this scandal go nationwide, surfacing in at least 10 states across America. Secretary Shinseki has ordered a nationwide audit to look at the management practices at VA medical centers. Several employees have been placed on administrative leave, and the VA Office of Inspector General is investigating the Phoenix VA. I respect the important role of the Inspector General, but my fellow veterans can't wait many months it may take to complete its report. They need answers, accountability, and leadership from this administration and Congress now. Clearly, the VA is suffering from systemic problems in its culture that require strong, reform-minded leadership and accountability to address. At the same time, Congress must provide VA administrators with greater abilities to hire and fire those charged with caring for our veterans. Most importantly, we must give veterans greater flexibility in how they get quality care in a timely manner rather than continue to rely on a department that appears riddled with systemic problems in delivering care. How we care for those who risked everything for us is the most important test of a nation's character. Today, we are failing that test. We must do better tomorrow, much better. For the 9 million American veterans enrolled in the VA today, and for the families whose tragic stories we heard last week in Phoenix, who I know are still grieving their losses, it's time we live up to Lincoln's injunction, which serves as the VA's model today, to care for him who shall have borne the battle, and for his widow and his orphan. As I said, it's time for answers, accountability, and leadership from this administration, and I look forward to hearing from Secretary Shinseki. I thank you, Mr. Chairman, and I thank Ranking Member Burr and the members of this committee.
Okay. Thank you, Senator McCain. I would like to now welcome retired U.S. Army General Eric K. Shinseki, Secretary of Veterans Affairs, to the first panel. As I think most people know, Secretary Shinseki is a graduate of West Point, served as the Chief of Staff of the Army from 1999 to 2003. He retired from active duty in 2003 after a nearly 40-year career in the U.S. Army. Following the September 11th 2001 terrorist attacks against our country, Secretary Shinseki led the Army during Operations Enduring Freedom and Iraqi Freedom. He previously served simultaneously as Commanding General, United States Army, Europe and 7th Army, Commanding General, NATO Land Forces, Central Europe, and Commander of the NATO-led Stabilization Force, Bosnia-Herzegovina. And I want to also note a few of the many awards that Secretary Shinseki received during his career: the Defense Distinguished Service Medal, the Legion of Merit with oak leaf clusters, the Bronze Star Medal with V device with 2 oak leaf clusters, and the Purple Heart with oak leaf clusters. Mr. Secretary, thank you very much for being with us today. Secretary Shinseki is accompanied by Dr. Robert Petzel, who is the Undersecretary for Health. Mr. Secretary, your prepared remarks will be submitted for the record. What I would like to do now is if both of you could rise and take the oath. I would ask that you, do you solemnly swear or affirm that the testimony you're about to give before the Senate Committee on Veterans Affairs will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you very much. Please be seated. Okay. Mr. Secretary and Dr. Petzel, the floor is yours.
Chairman Sanders, thank you very much for that more than generous introduction. To you and Ranking Member Burr and the members of this committee, thank you for this opportunity to discuss the state of VA healthcare. I've been taking oaths most of my life, Mr. Chairman, so whenever I appear before this committee, whether I'm sworn or not, you have my best answers based on what I know, as truthful a presentation as I can make. Deeply appreciate your support and unwavering support for our nation's veterans. That's been true for 5 years now that I've worked with members of this committee. Mr. Chairman, I would also like to recognize that in the room here are others with whom I've worked very closely for 5 years, developing good dialogue, good collaboration. They've been very helpful in shaping what we thought was a priority in the Department of Veterans Affairs, and it's been a good, strong relationship. And I thank them for their partnership, and I know some of them will be testifying before you today. In those cases where we haven't always seen eye to eye, we've always managed to find common ground on behalf of veterans, and I expect we'll do that again. We at VA are committed to consistently providing our veterans the high-quality care, timely benefits, and safe facilities necessary to improve their health and well-being. This commitment mandates a continuous effort to improve quality and safety. America's veterans deserve nothing less. Our quality and safety meet high standards, and veterans should feel safe in using VA health care. That said, in health care, Mr. Chairman, as you point out, there are always areas in need of improvement. Any allegation about patient care or employee misconduct are taken seriously. And based on the background you just described that I followed most of my life for 38 years in uniform, and I am now have this great privilege of being able to care for people I went to war with many years ago, and people I have sent to war, and people who raised me in the profession when I was a youngster. Any allegation, any adverse incident like this makes me mad as hell. I could use stronger language here, Mr. Chairman, but in deference to the committee, I won't. But at the same time, it also saddens me because I understand that out of those adverse events, a veteran and a veteran's family is dealing in the aftermath, and I always try to put myself in their shoes. In response to allegations about manipulation of appointment scheduling at Phoenix, I am committed to taking all actions necessary to identify exactly what the issues are, to fix them, and to strengthen veterans' trust in VA healthcare. First, the Office of the Inspector General, as many of you have pointed out, is now conducting a thorough and timely review. If any of these allegations are true with regard to scheduling at Phoenix and elsewhere where we've invited the IG to come and look at issues that surfaced, if any allegations are true, they're completely unacceptable to me, to veterans, and I will tell you the vast majority of dedicated VHA employees who come to work every day to do their best by those veterans. If any are substantiated by the Inspector General, we will act. And I take Senator Murray's encouragement here to do something different, and Senator, I will. It is important, however, to allow the Inspector General to complete his duty, which is to conduct an objective review and provide us the results. Second, I've directed VHA, as some of you have noted, to complete a nationwide access review of all other healthcare facilities to ensure full compliance with our scheduling policy. And as we've begun that, we've already received reports where compliance is under question, and we have asked the IG in a number of those cases to also take a look. Third, I've asked for and received the assistance from President Obama. The President has agreed to let his Deputy Chief of Staff for Policy, Rob Neighbors, assist us in our review of these allegations and in any other issues we may find during these reviews. We start with scheduling, but we'll go wherever the reviews take us. Rob is a fresh set of eyes. He's the son of a veteran, and he's a proven performer who brings broad and significant management experience to this task, and I welcome his assistance. I've known the Neighbors family for a long time. Rob's dad and I were served together for many years, and I know his mom and dad well, and I welcome the assistance of Rob Neighbors. Even as we take these proactive measures, it's important to remember that VHA conducted approximately 85 million outpatient clinic appointments last year. As a large integrated healthcare system, VHA operates, as has been noted, over 1,700 points of care, including 150 medical centers, 820 community-based outpatient clinics, 300 vet centers, 135 community living centers, 104 domiciliary rehabilitation treatment programs, and 70 mobile vet centers attempting to reach the most remote of our veterans. This is a demonstration of concern by this department, trying to make sure that every veteran, no matter where they live in this country, and even our overseas locations, have an equal opportunity to have access to quality health care. As Chairman has noted, VHA conducts approximately 236,000 appointments every day. Over 300,000 VHA employees provide exceptional care to the 6.5 million veterans and other beneficiaries annually. VA healthcare is comparable to that in the private sector, meeting or exceeding standards in many areas. We always endeavor to be fully transparent, fostering a culture that reports and evaluates errors in order to avoid repeating them. Every VA medical facility is accredited by the Joint Commission, the independent organization that ensures the quality of U.S. healthcare through comprehensive evaluations. In 2012, the Joint Commission recognized 19 VA hospitals as among its top performers, and last year that number increased to 32. Additionally, as the Chairman has pointed out, the most recent American Customer Satisfaction Index ranks VA customer satisfaction among the best in the nation, equal to or better than the ratings for private sector hospitals. An overwhelming 96% of veterans who use VA healthcare today indicated they would use us again the next time they needed inpatient care, 96%, and 95% for outpatient care. I want them to continue to have that level of trust. Veterans deserve to have full faith in their VA. VHA is committed to a process of full and open disclosures to veterans and their families whenever any adverse event occurs. We participate in multiple external independent reviews every year to ensure the safety and quality of health care. VA will continue to aggressively develop and sustain reliable systems and train employees to detect and prevent healthcare incidents before they happen. I have detailed some of our many significant healthcare accomplishments of VHA over the past 5 years in my written testimony. I appreciate the hard work and dedication of VA employees, our partners from the veteran service organizations, as I indicated in this room, community stakeholders, many of whom we deal with on a daily basis, and then our dedicated VA volunteers. I deeply respect the important role that Congress and the members of this committee play in serving our veterans, and I look forward to continuing our work with Congress to better serve them all. And again, Mr. Chairman, thank you for the opportunity to appear here today.
Thank you very much for your testimony, Mr. Secretary. I'm going to start off with a simple question, and I'm going to ask some harder questions. And you or Dr. Petzl can answer. Very simple question. The VA healthcare system is the largest integrated healthcare system in the United States of America. 6.5 million veterans access it every single day. Mr. Shinseki or Dr. Petzl, what are the strengths of the VA healthcare system? What are the problems in your judgment? Is it a good system?
Mr. Chairman, it's a good system, and it's comparable to any other healthcare system in the country. In some areas and some specific occasions, we exceed even those good systems. For 5 years now, we've focused on 3 major goals for VA, all of it focused on doing better by veterans, which is what the President asked me to do when I came here. The first was to increase access. I think we've been successful at this. We've enrolled 2 million more veterans into VA healthcare. I think there's a net here, somewhere around 1.4 million, 1.5 million who are net overall increases. But over 5 years, we've enrolled 2 million more veterans. The second focus was to go after this thing called the backlog. And we've had this discussion for a number of years now. But we didn't simply go after the backlog just to end what was then, 5 years ago, a set of claims. We also acknowledged that we hadn't done very well by veterans of previous conflicts. And so even as we committed to ending the backlog in 2015, we also went and tried to bring justice to those who had never had the opportunity to submit a claim. I called on the good people in the Veterans Benefits Administration to take this on, and they did. And I promised them we'd give them a new tool called the Veterans Benefits Management System. And in 3 years, we fielded this new automation tool that make them.
How did we used to do in 2008 benefits?
All paper.
All paper.
All paper. And if you wanted to go faster, Mr. Chairman, you had to hire more people. And we had done that over many years. I think we have, 11,000 people who process claims, which is...
What I want to do now, Mr. Secretary, is pick up on some of the points, I think legitimate points, made by Democrats and Republicans. And the major allegation, I think everybody here understands that when you treat 230,000 people a day, mistakes are going to be made. And that's true of any institution of that size. But here's the major criticism that I hear from Senator Burr, Senator Murray, Senator Begich, and others, that this is not new news, that this is not new news, that these concerns did not arise yesterday, they did not arise in Phoenix, but in fact, there have been reports by the Inspector General, by the General Accounting Office on numerous occasions about problems having to do with scheduling and with waiting lists. Could you address how it could happen that year after year, these reports were made and there has not been significant action?
Yeah. I think it's important here to look at the GAO and the IG reports and what they intend to do. And they come in and give us some sense of where we could be doing better. And we get in there and we address those issues and take corrective action and, in essence, close out the report. It doesn't mean that we have solved every issue. It does mean that we've taken care of addressing those issues, and then when they come back, there may be another set of issues to deal with. I do understand Senator Murray's suggestion that we ought to take a comprehensive look at
Well,
this.
I think what you're hearing from a number of senators and from myself is that everybody knows problems will arise tomorrow. That's not the criticism. The criticism is that year after year, reports have been made talking about these problems, and the problems continue to exist. Can you give us some assurance of what happens tomorrow? Where do we go from here so that we don't have this hearing next year or 2 years from now?
Sure. And I think that's what the audit that we've created is intended to do. So while the Inspector General is looking at Phoenix for evidence of employee misconduct and evidence that 40 veterans may have perished awaiting scheduling, the IG is going to get to the bottom of that. What we're attempting to do is to address the Senator's broader question, is to take a look at ourselves and not wait for the IG's outcomes. And already we've begun to see some evidence that people are coming forward and saying, hey, I think there's an issue here, which I encourage. I mean, that's what we're after here. And if there were performance issues in the past, if they're continuing today, we want to put a stop to it.
My last question, I've gone over my time, and is, in your judgment, based on what you know, are people, quote unquote, cooking the books? Is that, in fact, a problem within the healthcare system?
I'm not aware, and other than a number of isolated cases where there is evidence of that. But the fact that there is evidence in a couple of cases behooves us to go and take a thorough look. And that's why we have structured this audit so that a set of clinicians are not going to inspect their own areas. We've offset them so that a VISN 1 will inspect a VISN 10, and we'll get a comprehensive, a good look. But
I apologize, but my time has long expired. Senator Burr.
Thank you, Mr. Chairman. Mr. Secretary, again, welcome. These questions are for you, and I'll try to go as quickly as I can for the time constraints. Mr. Secretary, were you aware that on October 25th, 2013, the Office of Special Counsel requested that the VA conduct an investigation into the allegations of inappropriate scheduling at the Fort Collins Community Outpatient Clinic, and that since then the media has reported about Mr. Freeman's email of June 19, 2013 that explains how to game the system to avoid being on the bad boy list? Were you aware of those?
Senator, I became aware of that screenshot, I believe is what it was, screenshot of a employee who was suggesting there are ways to game. I put that employee on administrative leave.
When was that?
That was last Friday.
Okay, Mr. Secretary, it's my understanding that on June 21st, 2013, VA received a report from the Office of Medical Inspector regarding chronic understaffing issues at the Jackson VA Medical Center, and that report described multiple patient scheduling problems, including scheduling 2 patients for the same appointment slot and scheduling patients for a clinic that does not have any assigned providers, often referred to as ghost clinics, and that on September 17, 2013, the Office of Special Counsel submitted a letter to the President of the United States on which the VA was courtesy copied, describing the findings of that June 21st Office of Medical Inspector report on the Fort Jackson Medical Center, including the practice of double booking patients and the use of ghost clinics. Do you remember reading that report and receiving that copied letter to the President?
I can't say that I remember it today here.
Okay. There was a December 23rd, 2013 report by the Office of the Medical Inspector regarding the Cheyenne Medical Center and Fort Collins Clinic that found that several medical support assistants reported that, and I quote, medical centers' business office training included teaching them to make the desired date the actual appointment, and if the clinic needed to cancel appointments, they were instructed to change the desired date to within 14 days of the new appointment. Did you read that report?
That report has come to my attention here recently.
Okay. On February 25th, 2014, your Chief of Staff, Mr. Riojos, Riojas, submitted a response to the Office of Special Counsel, which included the December 23, 2013 Office of the Medical Inspector report on Fort Collins. And in that letter, Mr. Riojas states, and I quote, "However, as OMI, Office of Medical Investigation, was not provided any specific veterans cases affected by these practices, it cannot substantiate that the failure to properly train staff resulted in danger to public health or safety." Were you aware of what your Chief of Staff wrote?
I was.
Okay. Mr. Secretary, were you aware that the GAO report entitled VA Healthcare Reliability of Reported Outpatient Medical Appointment Wait Times and Scheduling Oversight Need Improvement, which was publicly released in January 2013, and then on December the 11th, 2012, to that same report, your former Chief of Staff, John Gingrich, sent a letter to the GAO which stated, and I quote, "VA generally agrees with the GAO conclusions and concurs with GAO recommendations to the Department." Do you remember that letter, that report, and your Chief of Staff's response?
In general, I do remember that report.
Well, Mr. Secretary, you knew that there were specific issues relating to scheduling and wait times as early as June 21, 2013 at Jackson, December 23, 2013 at Fort Collins, as well as numerous IG reports related to excessive wait times in January 2012 in Temple, Texas, September 2012 in Spokane, Washington, October 2012 in Cleveland, Ohio, September 2013 in Columbia, South Carolina, and December 2012, a GAO report which questions the validity and the reliability of the reported wait time performance measures, which brings us to today and Phoenix. On May 1, you publicly stated that you had removed Ms. Hellman as the medical director. And you stated then that that was to ensure the integrity of the IG's current investigation. On May 5th, Dr. Petzel conducted a conference call with all VISN directors, all medical directors, and the chief of staff, so a rather large group, to discuss the ongoing face-to-face audits of all VA centers and large community-based outpatient clinics. I have been told by sources that were on that call that during that call, Dr. Petzel made the statement that the removal of Ms. Hellman was, I quote, political, and that she's done nothing wrong. If you're asking us to wait till the investigation's over, doesn't the same apply to people who work for you? And Mr. Secretary, from all I've described to you and the current investigation that's currently going on, why should this committee or any veteran in America believe that change is going to happen as a result of what we're going through?
I was not aware of the phone call you referred to, and I'll look into it. I would just tell you that my removal of the director, placing her on administrative leave, was at the request of the IG. He is the lead in this comprehensive review. I don't get out ahead of him. He requested it, and I put Director Hellman and 2 other individuals on administrative leave.
I thank you, Mr. Chairman.
Thank you, Senator Burr. Senator Murray.
Secretary Shinseki, as I said in my opening, the announcement that the President is sending one of his top advisors to assist in this nationwide review is good news. I'm confident Mr. Neighbors will help make sure that this review is comprehensive and accurate. It is critical that this review is effective because at a hearing of this committee that I called in November of 2011, I asked Dr. Mary Schoen, VA's Director of Mental Health Operations, whether facilities were gaming the system and not fully reporting wait times, and she told me she was unaware of any facilities doing that and that VHA was doing audits to make sure it wasn't happening. But there, as you know, have been an overwhelming number of allegations system-wide that wait times are being doctored, and the oversight organizations have reported on it for years. The department so far has been unable to provide me even the most basic information on how this nationwide review is going to be conducted or what it will look like, and I hope that is about to change, and I want you to explain how this review is going to be conducted.
Let me call on Dr. Petzel to give you details.
Thank you, Mr. Secretary. Senator Murray, There are going to be several phases to what we do. This week, we are auditing with the in-person teams and an anonymous survey the first tranche of facilities, all 151 medical centers and our largest clinics. Starting next week, we're going to work our way down to all of the other sites of care, gathering information, and I think the anonymous nature of the questionnaire is particularly important, information about whether or not people have felt forced to do things that were inappropriate and lacking trust and integrity in the scheduling system. The second part of this is an assessment, as a number of people have mentioned, as to whether or not we have our resources deployed appropriately, whether or not we have the appropriate amount of resources, and just as importantly, whether or not we're using those resources in the best way at each one of our sites. I think everybody needs to remember that we do 85 million outpatient visits every year. 95% of those visits are with established patients, and those are all accomplished within 14 days.
I appreciate that. I want the details of how this is going to occur so that we get good information.
So we're going to focus on the new patient and the scheduling system that we have for new patients and all the other access points besides our clinics and our medical centers that we've got available for new patients. So first is the review to see how the scheduling system is being done. Second will be the look at whether or not we have.
Well, I would like to get the details from that on you, and I don't want to use all my time, but it's important that we know how that's going to be used and we know that real change occurs. But I just have a minute and a half left, and I want to ask you, Secretary Shinseki, Deputy Undersecretary for Health Bill Schoenhard told me at a hearing in 2012 that gaming is so prevalent as soon as new directives are put out, they're torn apart to find out how to get around the requirements. Testimony from a VA mental health employee said the exact same thing. And at that same hearing, Linda Halliday from the IG's office told us, and I quote, "If we have seen scheduling practices that resulted in gaming the system to make performance metrics look better at the end of the day over the past 7 years, they need a culture change. To get that culture change, I think they really need to hold the facility directors accountable for how well the data is actually being captured." That was more than 2 years ago, and the standard practice at the VA seems to be to hide the truth in order to look good. That has got to change once and for all, and I want to know how you're going to get your medical directors and your network leaders to tell you, whether it's through this survey or in the future, when they have a problem and will work with you to address it, rather than pursuing these secret lists and playing games with these wait times.
Well, Senator, if there's anything that gets me angrier than just hearing allegations is to hear you tell me that we have folks that can't be truthful because they think the system doesn't allow it.
Right.
You know, trust is an important aspect of everything we do here, and has been in my previous life as well. And in order to do that, we have to be transparent, and we have to hold people accountable. And what I will say to you is we're going to get into this, and it's important for me to assure veterans to regain their trust, whatever has been compromised here, that when they come to VA, they come to a good, safe, caring system, and that they'll be cared for. And for all of the employees that are listening in today, I expect our employees to provide the highest quality care, safest care we can provide, given all the comments about how tough it is in the healthcare industry, and provide access to benefits as quickly as we can. That's our mission. We only have one mission. It's taking care of these veterans, and not these veterans, I'm one of them. 100,000 of our employees at VA are veterans. We have a vested interest here to get this right.
This is absolutely critical. This review will not work if those people who are telling you the information do not tell you the truth.
I agree.
Okay. Thank you, Senator Murray. Senator Isaacson.
Thank you, Mr. Chairman.
For both of you gentlemen, do you know William Schoenhardt?
I do.
Yes. Do you know him, Dr. Spetzel?
I do.
On the 26th of April in 2010, he sent out a memo to all the visiting directors throughout the VA entitled Inappropriate Scheduling Practices. Paragraph 2 begins, "It has come to my attention that in order to improve scores on assorted access measures, certain facilities have adopted use of inappropriate scheduling practices, sometimes referred to as gaming strategies." Then paragraph 3, and I'm going to read the whole paragraph because this is the key to the question, and I think it's the key to the issue at the VA. "For your assistance," and there's an 8-page attachment to this. "For your assistance, attached is a listing of the inappropriate scheduling practices identified by a multi-VISN working group chartered by the System Redesign Office. Please be cautioned that since 2008, additional new or modified gaming strategies may have emerged, so do not consider this list a full description of all current possibilities or of inappropriate scheduling practices that need to be addressed. These practices will not be tolerated." Are you familiar with that memorandum?
I am not.
Dr. Petzl?
I am familiar with that memorandum, yes.
Well, if it's not going to be tolerated, and for over 4 years ago you had 8 pages of known practices for gaming the system, what action, if any, and I don't think any took place, did the VA do to respond to William Schoenhardt's memorandum to see to it the VISN and the hospital directors followed the orders?
We have worked very hard, Senator Isaacson, to root out these inappropriate uses of the scheduling system and these abuses. We have been working continuously to try and identify where those sites are and what we need to do to prevent that from happening. It's absolutely inexcusable. The scheduler's responsibility is to be sure that that program is administered with integrity.
What do you do when you uncover one? Surely you've uncovered one. What do you do to hold them accountable?
The individuals are, as you mentioned, held accountable. I can't give you an example specifically, but if someone were found to be manipulating inappropriately the scheduling system, they would be disciplined.
Would they lose their job?
I don't know whether that's the appropriate level of punishment or not.
Senator, we can probably give you a little better answer to this because you're focused on scheduling. What I can tell you is in 2012, we involuntarily removed 3,000 employees for either poor performance or misconduct. In 2013, another 3,000 employees were involuntarily removed, and among them there were some senior executives as well.
Are those removals a reassignment within the VA healthcare system?
Some may be reassignments, others were departures, some by retirement and others by in effect being let loose by VA, let go by VA.
Well, I've read this entire 8-page memorandum, and there is no gray area. It's not we think this is happening, it's we know this is happening, and there may be other ways of gaming the system. And it talks about it's done specifically for the purpose of improving scores on assorted access measures, which I guess means the way in which their performance is evaluated as an employee. Is that correct?
I'm going to take your direction here. I have
not read the memo.
So I would assume that that's the.
And I would assume if the System Redesign Office had a multi-VISN working group, do you know what the System Redesign Office is?
Dr. Petzl.
Yes.
What is that?
That's the group that's responsible for ensuring that we're designing the work within our clinics and operations in the most effective and efficient way. And they have been given, at that time, they were given responsibility for monitoring and keeping track of access.
Yeah, and it says that the listing of inappropriate scheduling practices was identified by the multi-VISN working group. So you had a group within the Veterans Administration that identified on the 26th of August, 2010, various and numerous practices where numbers were being manipulated for the purpose of better outcomes, I presume, in terms of how those people would be rated. It would seem to me like there should have been a systematic in-writing practice where the chain of command would see to it that was not tolerated, as the memo said, and there was accountability to be had, including the loss of a job.
Absolutely agree with you. And we did institute that appropriate level of accountability. I will find out. I don't know whether anybody was specifically disciplined around that issue, but this has been a very important thing to us for at least the last 4 years, Senator Isaacson, and we have tried to root out those places where the scheduling system was being used inappropriately. It's intolerable.
I know my time's up, but let me just say two things. One is, for the sake of the integrity of the Veterans Administration, you need to find out if there's an accountability system to respond to this memorandum from the 26th of August and what it was. And secondly, I'd like to ask unanimous consent to submit this memorandum for the record.
Without objection.
Thank you both.
Thank you. Senator Blumenthal.
Thank you, Mr. Chairman. Again, thank you to you and the other veterans who are here and who are listening for their interest and involvement in this issue. Secretary Shinseki, can you tell me how quickly we'll have some preliminary results to both the review and the IG investigation?
The Inspector General has his own timetable, and I don't have insights into what that is. On our audit, we're taking care of most of the large facilities this week. There will be some follow-up next week. Perhaps in about 3 weeks we'll have been able to assemble all the data, do a good analysis, and then respond in detail the way that
Can you commit that within 3 weeks you will have a report for us?
I think we should be able to do that, but that's preliminary right now. I don't know what data is being assembled, and collating it every day, but we'll shoot for 3 weeks.
And I apologize for interrupting, but as you know, all of our time is limited.
Sure.
As part of your management responsibility, don't you believe, and I certainly believe, that there's a responsibility from the IG to complete this report as quickly as possible within a matter of days and weeks, not months?
I agree that it would be helpful for the IG to complete his report as quickly as possible.
And can you give the IG a deadline?
I am not able to do that. The IG is an independent reviewer here, and once I turn this over to him, I'm primarily supporting his needs here. So,
well, let me raise sort of the elephant in the room. Isn't there evidence here of criminal wrongdoing? That is, falsifying records, false statements to the federal government? That's a crime under the...
It should be, yes.
And wouldn't it be appropriate to ask for assistance from the Federal Bureau of Investigation or some other similar agency, given that the IG's resources are so limited, that the task is so challenging, and the need for results is so powerful?
Again, I will work with the IG to make that available to him if that's his request.
Well, may I suggest respectfully, Mr. Secretary, that it's your responsibility to make that judgment about the IG's resources, and without rushing to judgment, without reaching any conclusions, to involve appropriate federal criminal investigative agencies if there is sufficient evidence of criminality. And in my judgment, there is more than sufficient reason to involve other investigative agencies here in light of the evidence, more than allegations, but evidence of potential false statements to the federal government, and the need for timeliness and promptness in results to restore trust and confidence. What I'm hearing from my colleagues is the background about the systematic failures here and the need for also greater transparency and accountability. So let me ask my next question.
Well, it's a discussion on resources that I have had repeatedly with the IG to make sure. But again, every discussion about do you have enough resources based on what is underway, each new discovery adds to that workload. And fair enough, I'll have that discussion with him again.
Let me ask, will you change your management team given that the background here shows systematic failings over a period of apparently years, not just months?
Yeah. Senator, I don't want to get ahead of myself or ahead of the IG here. I want to see the results. I want to see the results of the audit. And if changes are required, I'll take those actions.
If this evidence that we've seen already is as probative and powerful as it seems to be, wouldn't changing your management team be appropriate?
Perhaps. I'm still waiting for the results of the audit.
Thank you very much, Mr. Chairman.
Thank you, Senator Blumenthal. Senator Heller.
Thank you, Mr. Chairman. Mr. Secretary, I pointed out in my opening statement about the IG investigation about the treatment of a blind female veteran and the way she was treated at the emergency room in the VA hospital in Las Vegas. Have you had an opportunity to see the results of that investigation?
Senator Heller, I have had an opportunity to review that investigation, yes.
What was the conclusion?
Without revealing details about the individual, it was that she did wait too long and that there were others that waited too long in the emergency room. It did not have, in the estimation of the inspector, an impact on the eventual course of her illness, but it was inappropriate that a service-connected blind veteran should have to wait that long in our emergency room.
Thank you for the answer. Mr. Secretary, do you agree?
I do agree. I don't think any veteran, whatever the condition, should have to wait that long in any of our facilities, whether it's an emergency room or a clinic.
Yeah, Mr. Secretary, have you received complaints about patients' wait times, scheduling practices for any other facility in Nevada?
I'm not aware of another facility in Nevada. Dr. Petzel?
I'm not aware of it either. I don't know the results of our visits to either Reno or the Las Vegas hospital, but I have not heard anything.
Will all of Nevada's VA hospitals and clinics have face-to-face audits?
Yes, they will.
Will the VA conduct more thorough audits later with the IG?
If we find that there were instances where there might have been inappropriate criminal activity, we certainly will enjoin the IG to come. That's difficult to predict depending on what we find.
Senator, are you talking about a continuing series
Correct.
of audits? I think based on what we find, if there's a widespread systemic issue here, we'll set up a program of sustaining looks to make sure that we've rooted out the kind of behaviors that we're talking about, either alleged or in fact.
After conducting those investigations, will you make that available to myself and my staff?
Yes.
To any member of the Nevada delegation?
Yes.
Great. To go back, obviously with the issues, Mr. Secretary, with what's going on in Phoenix, the waiting room, the time waits that we're seeing across the country, and of course in my state of Nevada, and of course the disability claims backlogs that we're seeing 3 times longer in the state of Nevada than what it should be. Do you believe that you're ultimately responsible for all this?
I am. You and I had this discussion yesterday. I think I need to provide you data that would be a little more current than 3 times the national average on waits on backlog claims. Perhaps true at one time. I'm told that those numbers are down.
Today's numbers are 355 days.
That's on...
That's still 3 times longer than national average. Would you explain to me, after knowing all this information, why you should not resign?
Well, I tell you, Senator, that I came here to make things better for veterans. That was my appointment by the President. Every day I start out with the intent to, in fact, provide as much care and benefits for the people I went to war with and the people that I spent a good portion of my life doing. This is not a job. I'm here to accomplish a mission that I think they critically deserve and need. And I can tell you over the past 5 years, we've done a lot to make things better. We're not done yet. And I intend to continue this mission until I've satisfied either that goal, or I'm told by the Commander-in-Chief that my time has been served.
Mr. Secretary, thank you for being here today. Thank you, Mr. Chairman.
Thank you, Senator Heller. Senator Hirono.
Thank you, Mr. Chairman. In his testimony, Acting IG Mr. Griffin states that the VA's core mission is to provide quality health care. Is providing quality health care still VA's core mission, or have the goals of the VA shifted over time as they have expanded into providing other benefits to vets as well? And of course, I note that Congress has tasked the VA to provide job training, housing assistance, education assistance, reduce homelessness. So can you share your thoughts about what is the core mission now? And with all these other tasks that you now have, programs that you now have, are there, are you able to focus on your core mission of providing quality health care to our vets?
Yeah. Providing quality, safe, accessible health care for our veterans who have earned them is a core mission. But in order to provide that kind of health care, they still have to access the system. And that means we have to do a good job at dealing with disability claims. If we're not able to process those claims, the opportunity to access health care is something less. For the current generation of Iraq and Afghanistan veterans, it is automatic that they have 5 years of health care from VA. So for that group, that generation of veterans, it's a little different than others. So disability claims becomes an issue here, because that then renders the opportunity to take advantage of health care benefits. I would say homelessness is also part of our responsibility. 5 years ago, we talked about homelessness as though it were a thing out there. What we've learned in 5 years, because we focused on ending it, is that depression, major factors that lead to homelessness, depression, insomnia, pain, substance abuse, substance use disorders. And
Mr. Secretary, I'm sorry to interrupt, but my time is rapidly expiring, and the point of my question is that all of these areas that we have asked you to address with regard to our veterans, education needs, homeless issues, all of that, whether that is making it much harder for you to meet your core mission, and that may be a rhetorical question, so let me just move on to another area. As we look at the potential need for making systemic changes to how VA operates, I again note IG's testimony today on page 8, where he says that there is no national process to establish what are deemed essential positions to the delivery of health care. There is no standard organizational chart for VA hospitals and clinics, so it is very hard to determine what clinics are doing better than others. Would you consider these two areas to be potential systemic changes that we should be looking at making to the VA operations?
I think that's good insight here, and we will take a look at that. Part of our challenge is the complexity of the VA healthcare system. We have a series of hospitals that go from the very largest and most sophisticated, comprehensive kind of healthcare, organ transplants, brain surgery. We call them 1As, and then there are 1Bs and 1Cs, and then level 2 and 3s. All of this distinguishing between the level of care that can be provided there. It is a complex system, but I think standardizing the definitions of key leaders within that kind of framework would be helpful and sensible.
This next question may be one for Dr. Pretzel to very briefly respond to. We have heard that the VA has used bonuses and compensation as staff incentives to help bring down the patient wait times. And my question is, are these individual bonuses? Are these clinic bonuses? Are these individual compensations that occur? And how do you hold the staff accountable to ensure that these incentives are earned in an appropriate manner? What do you have in place to make sure that the gaming of the system is not occurring?
What you're referring to, I think, Senator, is the performance awards that are given at the end of the year. And each senior executive has a performance contract that has many, many elements, one of which, a subset of which, may relate to access. It could be stated in a variety of different ways. Has access improved, and then a percentage of improvement. Very few of them would state the absolute. Most of them are statements of what has been the improvement. So it is a part of a much more comprehensive evaluation system for senior executives.
But if you don't have accountability system in place, I think it certainly encourages the kind of activities that we are scrutinizing today. Thank you, Mr. Chairman.
Thank you very much. Senator Johanns.
Thank you, Mr. Chairman. Thanks for holding this important hearing, and I hope it's the first of many, many hearings. You know, Mr. Secretary, as you know, I occupied a cabinet post for a part of my career. There are some cabinet posts, as you know, by nature, are kind of a lightning rod. If you're going to be the Attorney General or the Secretary of State, you're going to get fired at every day. It's just part of the job description. The VA, on the other hand, in my judgment, does not fit into that category. And the other thing about the VA is because of the ranking member and chair and those who preceded them, it's a pretty nonpartisan committee. We don't sit around and talk about Republican Democrat stuff. We sit around and talk about how do we improve the lives of veterans who have served our country. And I've always applauded that. I think that we need more of that in Washington, not less. The other thing I'd mention is that there's been tough budget cycles. We know that. And yet you yourself have come to this committee many times and said you are resourcing us appropriately and generously under the circumstances, and we thank you for that. We applaud you for that. So then I look at this stuff and I go, what the heck? Mr. Secretary, one of the submissions we got from the American Legion was a map. Have they shared that with you, or has that come to your attention?
I think I may have seen a copy of that last evening.
This map is entitled Epidemic of VA Mismanagement, and it goes down through Burlington, Vermont, Pittsburgh, Durham, North Carolina, Columbia, South Carolina, Augusta, Georgia, Atlanta, Georgia, Jackson, Chicago, St. Louis, Austin, San Antonio, Cheyenne, Fort Collins, Phoenix, just place after place after place where the American Legion has thrown up their hands and said, my goodness, what the heck is going on here? Do you dispute what they're saying in this map? Do you think they are saying something here that's not true?
I am not aware of the basis for that map, but I accept that there are places that are listed here where we have had adverse events. And I would also point out that I don't know if in all, but in a good number, maybe the majority of those events, they were self-identified, initiated from within the Veterans Administration, Veterans Health Administration, which then allows us to go and investigate, figure out what happened, get the root causes, and then be transparent, tell people what happened.
But here's where I'm getting with this. So many hearings I've come to where we've talked about the waiting lists and the disability claims, and just kind of one thing after another. I just walk out of the hearing like I've been given an explanation, so I will quiet down and let you go back to work. And I don't see the change that is necessary. And what worries me about this, and what worries me about what we're dealing with here, is it's systemic. It's cultural. It's, people have just adopted this mode of operation as the way of doing business. Do you share my concern? Do you fear that the VA culture is such that every rule you put out, even after this, you say, okay, folks, from now on, we're going to do A, B, C, and D. That's an order. Comes from the very top, Secretary. Do you fear that people say, how do we game that? How do we get around that?
I'm sure someplace in a large organization, you're always going to have something like that. But this is part of the reason why I engage the veteran service organizations on a near monthly basis. If there are any straight shooters here, it'll be them in terms of being direct with this secretary. This is why I've spent a good bit of time traveling the country, going to our facilities and talking to them about what's important, and engaging veterans in those locations as well. The voices that are most important to me are the voices of the veterans I encounter out there. And I will say there's an occasional concern that's voiced to me, and I always bring it back and go to work on it. But I don't have, not received that systemic look that's being described. There is a distinction between a medical mistake and manipulation or cooking the books. In the case of a medical mistake, I want people to stand up and say, hey, something's wrong here. Something isn't working, or we made a mistake, or I made a mistake. To do that, you have to have the confidence and honesty on the part of the workforce. And in many of those examples cited on that map, that's what initiated our concern. Manipulation we'll get to the bottom of.
Thank you, Senator Johnson. At this point, what I would like to do is bring up these. Okay, Senator Begich is here. Okay, Senator Begich, do you have some questions?
Thank you, Mr. Chairman. I just wanted to catch that first vote as we were getting ready. First, again, I want to thank you all very much for being here. Thank you for the work we have done in Alaska. But let me just say that some of the comments I want to follow up on that other members have had. But let me first start with one, and I'm struggling here. I'll be very frank with you, Mr. Secretary, and I've again, all the good work we've done in Alaska to really go after some of these issues. Even though we're a small state, we've been able to accomplish some things that I think have made an improvement in delivery of services for our veterans. And to remind folks, having 77,000 veterans is a huge amount in Alaska. But the bigger issue is I was listening to Senator Burr's note of the 4-year memo and regarding identification of the issues that talked about scheduling and other issues. We talked about trust a little bit earlier, that it's important that we have trust with delivery of services and that we trust the people who are delivering the service of the VA. But if you have people, and I will tell you from my time as mayor, if you have people that have been identified to have manipulated records, I can tell you from the city side, we would fire them. Yeah. Because we've lost trust. If they're cheating, then they're not trustworthy. If you just transfer them to another part of the government, then they just perpetuate what they have done, and maybe in a different field. So my question is, and I know you talked about the 3,000 people you have moved, dismissed, retired, whatever, but I want to know specifically on this issue, have you ever fired anybody on this issue when you find out that they've manipulated the records? Because to me, it's the fundamental question, because if it's just shifted around, then we're not changing the system to improve it. Help me, and if you can't answer that now, I do want an answer, because this to me is a fundamental issue. I would, as a former mayor, we'd fire them. They'd be gone.
Yeah, I would have to give you an answer that looked at across those specific reasons that we released 3,000 people, Senator. Manipulation, the very specific. This is something for me more recent. And without getting ahead of decisions, I would say manipulation of data, of the truth, is serious with me.
Would you fire him?
I will do everything I can within.
That's not the question. I understand.
There is a process here, Senator. Let me not get out ahead of it, so that in the end I have it reversed because of predetermination.
Okay, let me ask you this then.
Yeah.
In the last, since that last document was done, was it Schoenparts, William Schoenparts? I can't remember the memo, but that report.
Right.
Clearly, that report identified some people who have been doing some manipulation. So the question is, from that report, let's not talk about the future for a second. Let's talk about that report and identify. Was anyone fired for that activity?
I do not know. I had not seen that memorandum, but I would say if there was any manipulation that identifies individuals, I would expect to have seen their names in that list of 3,000, and that's what I can't tell you today. I need to do some research.
Can you get for the record for that?
I will. Let me just ask Dr. Petzel if he has any better insight.
Okay.
I don't have any specific information, Senator Begich, but we can go back and try and resurrect whether or not that's occurred.
Because if we're going to try to rebuild the system, and again, I want to say that, you know, we saw this problem when I first came into Alaska. We had backlogs on claims. We had scheduling issues. We had a lot of things. But we went after it, right? We went after it jointly to figure out how to do this. We did MOUs with the Alaska Native Health Clinics. We went after it with CARE Closest to Home program, which I know is going to run out of money at the end of this fiscal year if we're not careful. There's a variety of things we went after to try to figure. So I know we can fix this problem, but we still have challenges. And I think the biggest challenge is if we don't hold people accountable for actions that they manipulated or they redrafted the records to make it look better, then we're never going to solve this problem. And sometimes you got to have some heads roll in order to get the system to shape up. Because sometimes if they know, well, I'm just going to get transferred or I'm on leave and I still get paid, what's the real penalty? I can just tell you again.
We're not in disagreement here.
Great. Okay. I just wanted to hear that clearly. And let me again say, Mr. Chairman, I know this is just one of many opportunities we'll have. I know you're waiting for the IG report. That will give us some more opportunity. I'm hopeful that IG report, when it comes out, that there will be immediate action based on the report, not a further study of the report. IG says, here's the problems, we need to get after it. Because if we don't get after it, the VAs in this country and in Alaska will be the ones who lose out at the end of the day. And I think you recognize that the veterans will be on the back end of this.
Thank you, Senator Begich. Senator Burr wanted 2 minutes, and I'll take 2 minutes as well. Now, those will be the last questions, and then we'll hear from the service organization. Senator Burr.
Thank you, Mr. Chairman. Mr. Secretary, in your testimony, you said, and I quote, I invited an independent investigation by the VA Office of Inspector General to conduct a comprehensive, thorough, timely review. If any allegations are true, they're completely unacceptable to veterans, to me, and to our dedicated VHA employees. If they are substantiated by the OIG, responsible and timely action will be taken. How do you define responsible and timely action?
There is a process to be able to implement those findings, decision regarding those substantiated findings. I will tell you it will be aggressive and as swift as I can make it. But there is a process here that's not entirely under my control.
Mr. Secretary, I'm sure you're aware of the IG report regarding the mismanagement of inpatient mental health care at the Atlanta VA Medical Center that was released April 17th of last year because Senator Isaacson and Dr. Petzel went personally and addressed it. And I'm sure you're aware that the IG report regarding the unexpected patient deaths in a substance abuse residential rehabilitation treatment program in the Miami VA Healthcare Center, because that was released on March 27th, 2014. In the IG's testimony that he'll give later, it says that both Miami and Atlanta, as the reports indicate, standard steps to ensure veterans were kept safe while under VA control were not taken and 2 veterans died. In each instance, VA managers did not ensure the hospital staff performed their jobs. One, I would assume that you find Miami and Atlanta as unacceptable, and if you will, tell me what we've done in a responsible and timely manner to remediate that problem.
Dr. Putzel.
In Atlanta, Senator Burr, there have been 7 disciplinary actions, including the retirement or removal of 3 senior officials.
And Miami?
And Miami is still in process. But we will do this as quickly as we are able to do.
Thank you, Mr. Chairman.
Thank you, Senator Burr. 2 questions in my brief time. Number one, you have heard serious problems about waiting times in various locations around the country. I think Dr. Petzel informed us that in the last few years we are seeing 2 million additional veterans coming into the system. Is that correct, Dr. Petzel?
2 million new patients have arrived since 2009 with a net increase of 1.4 million.
Okay. And I would suspect that some of those patients are coming in with some serious problems in terms of PTSD, TBI, and difficult issues, yes?
Yes, sir.
All right, so let me ask you a very simple question. To what degree does the VA not have the resources to address that increase in patients? Are a lot of patients coming into certain parts of this country, and are we seeing waiting lists because you simply don't have the resources? What's the answer?
Mr. Chairman, the ability to, as I've said earlier, the ability to provide appropriate access to these group of veterans depends on several things. One is the people. Do we have enough people? Two, are we using these people most effectively? And 3, are we using all the other things that are available to us? Telehealth, the fee basis program, et cetera.
Those are the issues. What's the answer?
Yes, one of the things that we're going to do is we're going to look at those places that are having access difficulties as a result of this audit and make a determination as to whether or not we have adequate resources there. My feeling now, my thought now is that we do, but we need to look carefully at those places where we are having access issues to see if it's a resource problem.
All right, let me simply conclude, and we're going to get to the...
Mr. Chairman,
yes.
May I add, this is not a once and done, or whenever we have a crisis, we do. This is an ongoing set of looks at ourselves.
Okay.
Our patient load grows each year, the complexity of the issues as you described. So this is an ongoing assessment that we try to get in the budget process, so there's an orderly decision-making.
Okay, my time has expired. Let me thank both of you very much for being here, and I would like to call up our second panel. The VA is a little bit different than other agencies because while it obviously serves and represents all of the people in our country, it has a very special constituency. and that is the men and women who have put their lives on the line to defend their country. Those are the people who utilize the VA every day. And today we're very pleased to have representatives from many of the major veterans organizations here with us, and I thank them all very much for being here. We are all interested to hear about your members' experiences with VA healthcare services. You know more about it because your people access the system every day. And we look forward to hearing your suggestions and your criticisms on how the VA can do better. I would like to remind each of you to keep your oral presentation to 5 minutes. And of course, your full statement will be printed in the record of the hearing. Our guests today are Daniel M. Dellinger, who is the National Commander of the American Legion, Joseph A. Violante, a National Legislative Director for the Disabled American Veterans, Tom Tarantino, Chief Policy Officer for the Iraq and Afghanistan Veterans of America, Carl Blake, who is the National Legislative Director of the Paralyzed Veterans of America, D. Wayne Robinson, President and CEO of Student Veterans of America, Ryan Gallucci, Deputy Director, National Legislative Service, Veterans of Foreign Wars of the United States, and Rick Weidman, Executive Director for Policy and Government Affairs of the Vietnam Veterans of America. I want to thank all of you for your honorable military service and for being with us today. Commander Dellinger, we will begin with you, please.
Good afternoon. Yesterday, we learned of a veteran in Vermont who died while trying to get mental health care from his local VA. His wife complained he would have to wait for hours just to be bounced around to different counselors. The American Legion expressed our concern about this very issue before the House Veterans Affairs Committee at the beginning of April, and again before this committee at the end of April. Our testimony is a matter of public record. Chairman Sanders, Ranking Member Burr, and distinguished members of this committee, on behalf of the 2.5 million members of the American Legion, plus another 1 million of our auxiliary and sons family members, thank you for holding this hearing and inviting me to share the views of the largest veterans service organization in the nation. 2 days ago, I was in Phoenix, Arizona. My system worth saving and I hosted a Veterans Hall meeting which lasted almost 4 hours. Attended by over 200, 62 spoke passionately about scheduling issues, over-medicating, and various other concerns at the hospital. I will be happy to discuss the details of that meeting with you during the question and answer period if you'd like to hear more about the information gathering session. So I am here today to help you understand why the American Legion believes the VA needs to address specific deficiency and also let you know that the American Legion fully supports the Department of Veterans Affairs. We supported the creation of the Veterans Administration in 1930 and fought hard to get VA elevated to cabinet level in 1989. We donate hundreds of thousands of hours each year to the VA along with millions of dollars and have scores of claims representatives. We help fund a brain research center in Minnesota and are currently representing 750,000 veterans as they file their claims with VA. Make no mistake about it, the American Legion believes in the VA. The allegation of the secret waiting list at Phoenix Department of Veterans Medical Center that are now being investigated, along with the 40 or more patient deaths, have rocked the veterans community. In addition to Phoenix, we now understand at least 6 additional VA locations have been identified as participating in veteran patient wait time manipulation. The allegations in Phoenix were not the only reason the American Legion decided to call for a leadership change at the VA. They were simply the final straw in a long list of systematic leadership failures that include construction delays and cost overruns, patient deaths due to Legionella, patient infections due to unsanitary colonoscopy equipment and dental equipment, unacceptable wait times for colonoscopies resulting in patient deaths, the abandonment of efforts to create a true, unified, and interoperable joint health care record for use by both the Department of Defense and Department of Veterans Affairs, VA's refusal to answer congressional inquiries, and VA's witnesses' failure to disclose all relevant truths when testifying before Congress. On Tuesday, we heard that Senator McCaskill is concerned enough about mismanagement and mental health waits at the St. Louis VA that she drafted a bipartisan letter with Senator Blunt to get to the bottom of it. The list continues to grow. When are things going to get better? It seems that a day cannot pass without a news report about the problems and difficulties the VA faces with delays and quality of care challenges. While we wait for things to get better, hundreds of thousands of veterans are waiting for a decision on their initial disability claim or appeal, which prevents them from receiving VA health care. While we wait, transitioning service members are falling through the cracks due to DOD and VA's inability to create a single interoperative medical record. While we wait, officials in VA Central Office are preventing hospitals from being transparent during a crisis. While we wait, veteran suicides continue to plague our nation at a rate of 22 per day with no clear strategy from VA on proactively addressing suicides. Again, I'd like to thank you for this opportunity to speak with you today and welcome your questions.
Thank you very much, Commander Dellinger. Mr. Violante.
Chairman Sanders, Ranking Member Burr, and members of the committee, thank you for inviting DAV to testify today about the state of VA health care. DAV remains deeply concerned about allegations that VA employees or management took actions that obscure the true picture of access problems at some VA facilities. We fully support the ongoing investigation by the Inspector General and will demand full accountability for anyone found to have violated the laws or failed to follow and enforce VA rules and regulations. We also support Secretary Shinseki's initiative to audit all VA facilities to determine whether similar problems are occurring. However, we strongly recommend the VA include outside third-party experts to increase its objectivity and credibility and help regain the full trust of veterans and the American people. Mr. Chairman, while no health care system is perfect and medicine is far from an exact science, veterans have earned the right to expect the VA health care system to provide high-quality medical care. While it may be weeks or months before the investigations and audits are completed, we continue to have confidence that the VA, led by Secretary Shinseki, can and will correct any problems identified or uncovered. This Secretary has a track record of directly and honestly confronting problems and working with stakeholders to correct them. Mr. Chairman, we continue to believe that VA provides high-quality health care for the vast majority of veterans treated each year, and that veterans are now and will be better served in the future by a robust VA health care system than any other model of care. The real challenge facing VA and the root cause of the problems being reported today have to do with access to care rather than the quality of care delivered. For the past decade, DAV and our partners in the independent budget have pointed out funding shortfalls in VA's medical care and construction budgets. In the prior 10 VA budgets, funding for medical care provided by Congress was more than $5.5 billion less than the IB recommended. For FY 2015, the IB recommends over $2 billion more than VA requested. I would point out that you, Mr. Chairman, did call for an increase of $1.6 billion for FY 2015. But based on available information today, it appears your Senate colleagues will not significantly increase the administration's inadequate request, just as the House already failed to do. Similarly, over the past decade, funding requested by VA for construction and the amount appropriated by Congress has been more than $9 billion less than the IB recommendations. For FY 2015, the VA budget request is $2.5 billion less than the IB recommendation, which was based upon VA's own analysis. We agree with your views and estimate letters for the past 2 years, Mr. Chairman, where you stated that the administration budget's request for construction has been, and I quote, clearly insufficient to meet the identified needs, end quote, but unfortunately, Congress took no action to increase construction funding. Finally, VA needs to better utilize its purchase care authority. DAV believes that whenever an enrolled veteran is unable to receive care directly from VA within established timeframes, VA must take responsibility to find alternative means to provide and coordinate such care. However, since each dollar used to pay for non-VA care is $1 less that is available to hire new VA staff required to treat veterans in a timely manner, VA must provide accurate estimates of the additional funding required, and Congress must appropriate those dollars. Even with sufficient funding, how will non-VA care be coordinated with VA care? Are there even sufficient qualified providers available in each community? Simply giving a veteran a plastic card and wishing them good luck in the private sector is no substitute for a fully coordinated system of health care. Mr. Chairman, looking at VA today and putting it into proper perspective, the entire American system of health care, we continue to have confidence that veterans are well served by seeking their care from VA. We remain confident that VA and Secretary Shinseki, working with stakeholders and Congress, can, will, and must address these challenges. American veterans deserve nothing less. Thank you.
Thank you very much, Mr. Violante. Tom Tarantino.
Chairman Sanders, Ranking Member Burr, and distinguished members of the committee, on behalf of Iraq and Afghanistan Veterans of America, I thank you for this opportunity to share our views and recommendations regarding the current state of health care with the VA. For nearly a decade, IAVA has been a tireless leader working on behalf of veterans and their families to ensure that VA meets the needs of our community. After spending 13 years at war, the VA has been confronted with significant challenges administering timely care and services to veterans. Many have been overcome, but still clearly far too many remain. In the past few weeks, serious allegations of misconduct have arisen from several VA medical facilities indicating that records are being intentionally doctored in order to falsely portray patient wait times as reasonable and satisfactory. Disturbingly, long wait times have alleged to be the result of 40 deaths, 40 veterans who perished while waiting for care at the Phoenix VA medical facility alone. And since Phoenix, more allegations of misconduct at other facilities from coast to coast are painting a similar picture. Unfortunately, these types of incidents are not new, nor are they apparently unique. It is time for bold reform and new measures of accountability and oversight. Our members are outraged and expect substantive and meaningful evidence that long-standing inefficiencies are being appropriately addressed and appropriate VA personnel are being held accountable. Veterans must be assured that VA can deliver quality care in a timely manner, and veterans are tired of business as usual. IAVA also expects the VA to fully comply with the subpoena issued by the House Committee on Veterans Affairs. Full and swift compliance with this subpoena will be a good first step in not only figuring out what happened in Phoenix, but demonstrating how allegations of misconduct will be addressed at other VA facilities. And just like the Secretary, we are also awaiting the results of the Inspector General's investigation of alleged misconduct in Phoenix. But we can't sit around idle while the investigation is underway. We applaud the full audit of all 1,700 points of care at VA. However, we expect results and action in weeks, not months. Additionally, we support and encourage concurrent investigations that are completely independent of VA. Veterans need to see the Secretary step out in front on this issue and lead. We want a proactive Secretary, not a reactive one. Controlling the public message is critical, and if the Secretary cannot do it, veterans and the American public will continue to lose faith in the VA system. Accountability is a fundamental principle necessary for any organization to properly function. Yet, VA's incidence of mismanaged care would indicate that such a thing is missing from all levels at VA. Secretary Shinseki has finally started to emerge publicly and address these allegations, but we need to be clear that short-term reactive measures will not eradicate the most pervasive problems causing veterans to lose faith in this system. VA has a long way to go to earn back the confidence of millions of veterans shaken by this growing controversy. Although recently exposed by whistleblowers, allegations of long wait times at VA are actually nothing new. The GAO has conducted numerous studies over the last decade touching on scheduling inefficiencies at VA, and their findings continue to center around lack of oversight, inadequate training, ambiguous policies and procedures. In other words, weak leadership. Now, long wait times are one thing. Essentially, they're a management and process problem. They can solve with a combination of people and time and resources and more effective business practices. They are solvable as long as good leaders have the tools and information they need to fix it. That does not seem to be the case here. Instead of leaders coming forward to fix the system, they appear to be fixing the books. This is indicative of a culture of failed oversight and no accountability. Now, reasons for highlighting VA mismanagement and bureaucratic flaws are not done lightly, nor should they be. The worst thing that can happen in our community is a sense that the VA is so inefficient and terrible at administrating care that veterans lose faith in the system designed to take care of their needs. Now, the right answer to this is not to cover up problems in VA, but to solve them or keep them from happening in the first place. And this isn't just a matter of communication, it's a matter of lives. Of the estimated 22 veterans who die by suicide per day, 17 have not sought care at the VA. Despite the VA's many problems, seeking care works and can save lives. It is absolutely critical that veterans who need care feel encouraged to seek it. In order to improve the system of care and reassure veterans about VA's capabilities, legislation such as the Suicide Prevention for American Veterans and the VA Management Accountability Act should be enacted into law immediately. Our membership and the veterans community as a whole needs to be reassured by VA and Congress that despite these issues, the VA is there to serve them and that any charges of misconduct will be addressed and swiftly corrected. We also need to ensure that we know the full scope of mismanagement and cover-up at the VA system. This is why IAVA is proud to work with the Project on Government Oversight to protect VA whistleblowers. VA employees can come forward confidentially by going to vaoversight.org. Mr. Chairman, we again appreciate the opportunity to offer our views on this critically important and urgent topic. We look forward to continuing to work with you, your committee, your staff, and the VA to improve the lives of veterans and their families. Thank you for your time and attention.
Thank you, Mr. Tarantino. Carl Blake is the National Legislative Director, Paralyzed Veterans of America. Mr. Blake.
Chairman Sanders, Ranking Member Burr, and members of the committee, on behalf of Paralyzed Veterans of America, I'd like to thank you for the opportunity to testify today on the state of health care delivered by the Department of Veterans Affairs and the spinal cord injury system of care. No group of veterans understands the full scope of care provided by the VA better than PVA's members, veterans who have incurred a spinal cord injury or dysfunction. PVA members are the highest percentage users of VA health care. Let me begin by saying that PVA is deeply disappointed by the number of reports from around the country that suggest that veterans' health care is being compromised. There are undoubtedly serious access problems in the VA. I'd like to associate myself with the comments made by Senator Isaacson and Senator Begich regarding gaming the system and, for all intents and purposes, cheating the standard. If that's going on, and when cases are found where that's going on, serious and appropriate actions should be taken. If that means people have to be fired, so be it. That's what has to happen. However, we believe that a thorough analysis to understand the depth of this situation across the system should be completed before any final decisions about the VA leadership are made. At this time, PVA fully stands behind Secretary Shinseki. We believe he's committed to fixing these problems, and he should be afforded the opportunity to get it right. I'd like to emphasize, however, that the narrative that has been created by the media does not necessarily reflect what is happening inside the walls of the VA healthcare system. The committee really wants to gauge what is going on and how the quality of care is being delivered. I would ask you to spend a day walking around inside a local VA hospital, talking to veterans and discussing their health care experiences, not sitting in front of a pre-screened, pre-selected panel of veterans to support sweeping generalizations and to stoke public outrage. The fact is that the VA healthcare services, by and large, are excellent. Patient satisfaction surveys of the VA support that assertion. The primary complaint that we hear all of the time from veterans is how long they had to wait to be seen for an initial appointment or to receive care. At its core, this is an access problem, not a quality of care problem. These are not the same thing. And to be clear, sending veterans outside of the VA to get private care is not the solution to this problem. It might be part of a solution. It is not the solution, particularly for veterans who rely on the VA's specialized services. The fact is that there are not comparable services to the VA's SCI service, blinded care, amputee care, and the wide variety of specialized care that the VA provides in the private sector. Our written statement provides a snapshot of the VA spinal cord injury system of care. We've clearly identified serious staffing shortages that exist in the SCI service, particularly on the nurse staffing side. The site visits that we have conducted with our medical services teams for nearly 3 decades provide us the unique authority to affirm those problems. Unfortunately, those staffing shortages severely limit access to the system, while also placing the healthcare delivery for veterans at risk. Insufficient staffing, and by extension, insufficient capacity, is ultimately a reflection of insufficient resources that this administration and previous administrations have requested for health care and insufficient resources that Congress has ultimately provided. The independent budget, co-authored by PVA, AMVETS, DAV, and the VFW, has made recommendations to adequately fund VA health care for 28 years. For the last several years, Congress has essentially ignored our recommendations. And now here we are discussing how could this have all happened. I would agree with Senator Johans, who indicated, what the heck is going on when he looks at this and considers the budgets that have been requested. I'd suggest that the great irony of this hearing today is the discussion about, is the OIG adequately funded to do these investigations? Is the VA healthcare system adequately funded to deliver timely, quality care? I would suggest the answer to that question is no. Until the Congress and the administration commit to providing truly sufficient resources to hire adequate staff and establish real capacity, the problems being reported around the country will only get worse. The administration and Congress both bear the responsibility of these problems. Veterans pay the cost, sometimes with their lives, of inaction resulting from partisan bickering and political gridlock. Political interests do not come before the needs of the men and women who have served and sacrificed for this country. We call on this committee, Congress as a whole, and the administration to redouble your efforts to ensure that veterans get the absolute best health care provided when they need it, not when it is convenient. PVA members and all veterans will not stand for anything less. I thank you again, Mr. Chairman. I'd be happy to answer any questions that you might have.
Thank you very much, Mr. Blake. D. Wayne Robinson is the President and CEO of Student Veterans of America. Mr. Robinson.
Chairman Sanders, Ranking Member Burr, and members of the committee, thank you for inviting Student Veterans of America to submit our testimony on the state of VA health care. As the premier advocate for student veterans in higher education, it is our privilege to share our on-the-ground perspective with you today. I'd like to begin by addressing the family members of the veterans for whom we are gathered today. We at Student Veterans of America honor the service of your loved ones and stand with you in seeking answers related to their deaths. Student Veterans of America, or SVA, is a network of over 1,000 chapters on as many campuses across all 50 states and 3 countries. These chapters are comprised of veterans from multiple eras of service, with the majority having served after 9/11. Paramount to their success is the ability to remain healthy and utilize the healthcare system provided by the Department of Veterans Affairs. In this testimony, we speak on student-level issues of health and well-being, with our main focus being on higher education. As the GI Bill makes up a major portion of the benefits administered by the VA, we believe it is essential to consider education and the role it plays in the life of veterans who may simultaneously be receiving health care. As a former Command Sergeant Major in the Army, with service spanning nearly 3 decades, and as the current leader of a large, disparate organization, I understand how difficult it is to be responsible for many locations and workforces. I also understand the position of older and younger veterans, as I've served alongside, have led, and have been taught by both. Many of these friends and former leaders of mine ensure that I remain abreast of the issues they face while accessing care. Some veterans, student veterans, are as diverse as our nation and are progressing toward degrees at varying stages of their lives. Likewise, our members have millions of experiences with the VA and other large institutions integral to their success on a daily basis. They rely on the VA every day for their livelihood, their health care, and the future success of themselves and their families. This support system for student veterans may be understood by looking at 3 levels of support, which we term the 3 pillars. We encourage this committee to focus on the following 3 pillars of student veteran well-being individually as well as collectively. Pillar 1, institutions. Institutional support for student veterans is an important aspect of maintaining a strong pipeline of successful veteran graduates. Pillar 2, individuals. Establishing an environment for the student veteran to fluidly interact with the institution and the community is a determining factor of well-being. Pillar 3, communities. An established network across various university offices, academic networks, and career services enables the student veteran to make the transition from the campus to a fulfilling career. It is the firm belief of SVA that the VA has successfully overhauled the education benefits process and that this same level of production should be sought within all components of the department. Over the last 5 years, Secretary Shinseki has led the VA as it brought GI Bill processing times down to just 1 week and tripled the number of vet success on campus sites across the country. In that same time, the VA has paid out more than $40 billion in tuition and benefits to nearly 1.2 million veterans, service members, and their families since the post-9/11 GI Bill went into effect on August 1st, 2009. We recognize that the VA has a long way to go on some of its programs. It is our sincere hope that the Secretary is able to achieve the kind of outcomes across the department that he has accomplished for student veterans with the implementation of its benefits programs. SVA believes that Secretary Shinseki is dedicated to Americans' veterans more than ever. It has been under his leadership that the VA has seen substantial improvements over the years. While the recent allegations are disturbing indeed, we would encourage the Secretary to take swift and decisive action when the full facts become clear. This action would demonstrate his continued commitment to student veterans who utilize the VA healthcare system and to veterans everywhere. We thank the chairman, ranking member, and the committee members for your time, attention, and devotion to this cause. As always, we welcome your feedback and your questions.
Thank you very much, Mr. Robinson. Ryan Gallucci is the Deputy Director of the National Legislative Service, VFW. Mr. Gallucci.
Thank you, Mr. Chairman. Ranking Member Burr and members of the committee, I wish I didn't have to be here today, but on behalf of the 1.2 million members of the Veterans of Foreign Wars, I want to thank you for the opportunity to share the VFW's concerns on VA healthcare delivery. Simply put, VFW members are outraged, and I'm personally outraged that the healthcare system that I use may be doing harm to my fellow veterans. What is more frustrating is that nearly a month after some of these allegations came out, we still do not have the facts. We do not know who the veterans are who may have died waiting for care in Phoenix. We do not know where hospitals are cooking the books and appointment scheduling to keep up appearances while veterans wait for care or pay for it out of pocket. Regardless of what comes out in Phoenix, Wyoming, Atlanta, Chicago, Spokane, or elsewhere, the VFW knows that veterans have died waiting. This is inexcusable. VA is supposed to have protocols in place to make sure this never happens. So what happened? VA tells us the situation is improving, but to the veterans affected, this is not good enough. Over the last month, we see that VA may not be living up to its obligation to provide our veterans with the best care our nation has to offer. Veterans deserve the truth, not vague platitudes about quotas, wait times, and pending investigations. The VFW has been frustrated at the situation, but we have been reticent to condemn individuals without all the facts. We're here today to say that enough is enough. Whistleblowers first brought problems in Phoenix to the attention of VA and Congress as early as 2010. CNN broke the doors off this story a couple of weeks back. Why are we still waiting? Last week, the VFW grew tired of waiting and told veterans to call our helpline, 1-800-VFW-1899, to voice their concerns and connect with some of our service officers to help. While some said they were satisfied, most painted a picture of a VA healthcare system that is overburdened, under-resourced, and many times paranoid. In Durham, North Carolina, an Iraq veteran told me that he can see his primary care doctor only once a year and that he has sought care elsewhere, out of pocket, after 10 years of misdiagnoses. What we've heard over the last week is only a small sample of the hundreds of concerns we heard from veterans from coast to coast, but the outpouring of concern was alarming and seemingly systemic. So what is causing this failure? Is it a lack of resources, personnel? Is it leadership? The VFW also plans to conduct a series of Veterans Town Hall meetings talking to veterans face-to-face. Once we have finalized locations and dates, we will invite this committee to attend and hear directly from our veterans. As a veteran who uses VA care, I worry that the recent allegations are causing veterans and their families to lose confidence in the system that is designed to support them and care for their needs. If one veteran is not receiving the care he or she needs, it is one too many. VFW members demand answers, and we want those responsible for any wrongdoing held accountable at all levels of leadership and to the fullest extent of the law. With this in mind, the VFW believes it may be time to commission an independent review of VA care. We hope that VA would never intentionally deny care to veterans, but there have to be reasons why care takes so long to be delivered. The VFW worries that the current culture may be focused on making funding fit at every level, as my colleagues from Paralyzed Veterans of America outlined. If this is the case, the culture must change. Leadership at every level must have the confidence that if they have a need, they can ask for it to be addressed. We know capacity is an issue. The VFW and our other partners on the independent budget have for years highlighted the need to increase VA capacity. In 2004, utilization was at 80%. In 2010, 122%. And in 2013, down to 119%, which is still unacceptably high. This undoubtedly affects VA's ability to deliver care. Plus, when there's a lack of resources, there's a tendency to make trade-offs, whether through delaying care or gaming the schedule to satisfy quotas. The VA healthcare system was commissioned to care for those who served and bled for our nation. Men and women who are chosen as stewards of this system have been entrusted with a mission that cannot fail. If the system is failing, it is their duty to fix it. It is their duty to hold underperforming employees accountable. Most importantly, if they are unwilling to perform the mission, it is their duty to either ask for help or step aside. However, in addressing any failures, we must resist any suggestion that VHA is a fundamental failure that should be dismantled in favor of an alternative model. This only relieves VA of its responsibility. Last year, the President met with then VFW Commander-in-Chief John Hamilton and promised that he would not leave VA's problems to his successor. Last week, VFW Commander-in-Chief Bill Fine sent a letter to the President reiterating these concerns. We learned last night that the President shares the concerns of the VFW. Today, we ask not only for the President to live up to his word, but we implore Congress to do the same. We cannot sit on our hands and wait for the system to slowly improve. The situation that is unfolding across the country demands immediate, decisive action. The mission of VA healthcare is far too important, and as veterans advocates and users of this system, we will not allow it to fail. Mr. Chairman, this concludes my testimony, and I'm happy to answer any questions you or the committee may have.
Thank you, Mr. Gallucci. Rick Weidman is the Executive Director for Policy and Government Affairs of Vietnam Veterans of America. Mr. Weidman.
Thank you, Mr. Chairman, for the opportunity to be here today. Let me just say one thing that has troubled us for a long time, and that's the lack of truthfulness on the part of some people in senior grades at VA, both in shading the truth in hearings on the Hill, but also reporting up. And it's something that baffles all of us from the VSOs. If I lie to our national president, John Rowan, I'm toast. I'm out of here. I'm fired, and you're gone, pal. And I agree with that decision. You can't run an organization, and certainly not a medical organization, where people do not tell the truth to their superiors, and because otherwise, if they don't have good information, they can't manage properly. I will say that it is our firm contention that the majority of people who use VA get good to excellent care. The problem has to do with access and with poor quality assurance. It's very uneven. The plain fact is that there are not enough clinicians. It is very much analogous to Walter Reed, which I think many of you remember, in 2006. It's a question of too many clinical needs chasing too few clinicians. And what happens is distortion in the system and breakdown of the sequencing of care, and that was what was wrong with the care. That's what's wrong with the care at VA. There aren't enough clinicians, and it is getting people to care exactly when they need it that is not happening. The question is there enough resources for Veterans Health Administration? And we have to say we don't know. What we've been saying for 5 years is when the budget started to go up, the largest increase in the health care budget for VA since the end of World War II, that too many middle people positions were being created. Congress gave that huge increase to VA to hire more direct service providers, more doctors, more nurse practitioners, more clinicians and counselors, etc. But it ended up that there, in some places, the resources are deployed all wrong. It may be that there has to be a supplemental, but we would urge that the review that goes on be a position by position and facility by facility review with everybody who's not directly involved in patient care. You have to justify that position and why and how it adds to the overall enterprise of delivering quality care to veterans in a timely manner in a place where they can access it. Part of that problem with resources is, we've said it ever since they started using it at VA, the Millman formula is a civilian formula. It does not take into account, that's what they use to estimate the amount of resources that they would need. And we have exposures to things that, from my lips to God's ear, the civilian population of the United States will never be exposed to, and not just hostile fire, but chemicals and on and on. What it means is that when at VA hospitals, the average presentations or things wrong with an individual is 5 to 7 per individual. The Millman formula was built on a middle class PPOs and HMOs, and they had 1 to 3 average presentations or things that were wrong with them. What that means is the burn rate of resources at VA is much higher. That's particularly true as us old guys from Vietnam age and become even more aged, and our uncles from Korea and our fathers from World War II, but it's also true of the young people coming home today. Their presentations per individual of OIF, OEF, OND veterans is over a dozen for each individual comes through. So the point is, we need to reprogram some money. We need to have pick up the Management Accountability Act on this side of the Hill and pass that, and reprogram money and frankly go for a supplemental if that turns out that it's needed. In the meantime, we would urge everybody, every hospital, something we've been urging, is screen everybody at the hospital with for the 5 major killers. Lung Cancer Alliance, VVA's worked with for the last couple of years. VA has yet to do one of these screenings on a mass basis, and do it for the 5 major killers: lung cancer, prostate cancer, colorectal cancer, bladder cancer, and for heart conditions. If you screen everybody, then you don't have that kind of situation developed in Phoenix. I thank you very much, Mr. Chairman.
Thank you, Mr. Weidman. And thank you all very much for your excellent testimony. Let me start off with a fairly simple question. I think it was Mr. Blake, Mr. Weidman, and others talk that in general, we all are aware, no one here disputes that there are serious problems and serious allegations. But some of you have said that the quality of care at the VA that your members are receiving are good to excellent. Do you agree with that? Is the quality of care that your members are receiving, is it adequate? Is it good care, or is it not? We all know that there are exceptions out there. But let me hear that answer briefly, if I could. Commander Dellinger?
We would agree with your assessment, Mr. Chairman. The overall quality of care after they get into the system and actually get into the hospitals and the clinics are very good.
Okay, Mr. Violante?
Yes, Mr. Chairman, our members believe the same thing. The quality of care they receive when they get in is excellent.
Mr. Tarantino?
Mr. Chairman, when we survey our members, we find that their experience with VA, while a bit negative, their actual individual care is incredibly positive.
Incredibly positive.
But that's also including the use of their GI Bill and home loans and medical care, yes.
Mr. Blake?
My comments spoke for themselves, Senator.
Mr. Robinson?
Yes, I would agree with my colleagues that once the system has been accessed, that quality is good.
Mr. Colucci?
I would agree that the issue lies within access. To expand on that a little, one of the things that I wanted to point out is I said I use VA, and I do. I was there last week. But what happens is sometimes the person you get on the other end of the phone may not understand policies, may not understand proper procedures. When I see my clinicians, they offer me top-notch care, and that's a lot of what we heard from our veterans who responded to our inquiry last week.
Mr. Weidman?
It's generally good to excellent. The problem has to do with case management and access to the system.
Okay. Let me ask another question. And we all recognize, everybody up at your table and everybody here, that anybody who is lying with the VA, anybody who is cooking the books in the VA, totally, absolutely unacceptable. We demand accountability. People lying should be fired. I don't think there's much debate. We don't have to go into that at great length. But I want to ask what seems to be a problem, not all over the country, but in many parts of the country, and all of you have basically referred to it, is access. What I'm hearing you say is once people get into the system, the quality of care is pretty good. Problem is access. We have heard Mr. Blake talk about the independent budget, which is the budget done by a number of the veterans organizations assessing what they believe the needs of the VA are. I support that budget. Bottom line is, and I'll start with Commander Dellinger, do you believe the VA needs more funding in order to deal with the access issue, make sure that people all over the country can get into the system in a timely manner? Commander?
I do believe it is underfunded, but I also believe that there should be reallocation of funds within the system.
Good point. And others can speak to that as well. Mr. Violante.
Yes, Mr. Chairman. I think clearly the problem rests with a lot of the management efficiencies that the administrations have tried to put into the budget. A recent GAO report in February of 2012 indicated VA reduced their budget by $2.5 billion based on management efficiencies, which were not realized and which are impacting the resources. So this has gone on in previous administrations, and that needs to be stopped. That's like gaming the system.
Right. Mr. Tarantino.
The VA is underfunded, but throwing money at the problem doesn't help unless you have clear lines of accountability and reform for the things that are not working.
Mr. Blake.
I would agree with Mr. Tarantino. I mean, you can't just throw money at the problem if it's not done smartly. Mr. Weidman pointed out that there were a lot of people hired and they weren't necessarily hired where the need is. Our own written testimony points out serious staffing shortages in the entire SCI service. So clearly people are not being hired there where there's a demonstrated need. So you could do reallocation of resources, but we believe by extension there's even more need for additional resources.
Mr. Robinson.
I will agree with my my two colleagues to my right that yes, the VA is underfunded. However, I would say first there should be infrastructure and systemic reviews and issues addressed, and then after that, after we're intelligent on where the funds will be allocated, then they should be funded. Thank you.
Mr. Gallucci.
I would agree with our independent budget partners that we support the IB's numbers and we believe that VA in its current form is underfunded.
You guys are part of the independent budget, are you not?
Yes.
Yeah. Right.
And as far as, and I would echo the concerns of everyone at the table about resource utilization and proper distribution of resources. And my written testimony spoke about VA's capacity. What this has to do with is construction and facilities, a little to what my colleague Wayne was talking about. If we don't have the space, where are these clinicians supposed to practice? We've seen that problem with mental health hiring. They're able to hire more mental health practitioners, but where are they going to see their patients?
Mr. Weidman.
Part of it is the allocation of resources, but in addition, I would associate particularly the, not the major construction, but remodeling and adding to existing facilities. You got to have a place to actually deliver the care. But we're underfunded and don't have enough clinicians. That's why they game this system, not because they're bad people. They're under pressure not to admit there aren't enough docs.
Okay, I'm going to take a little bit more time, and Mr. Isaacson, I'll give you an equal amount of time. So, okay, but just wanted to ask one brief question, which is important. When you deal with a public system, like the VA, every problem, in a sense, sometimes makes the front pages. I mentioned earlier that there are studies out there, 200,000 or 300,000 people are dying from medical errors in private hospitals. You usually don't have hearings like this and TV cameras talking about it. On the other hand, the advantage of a public system is that as citizens of the country and as representing millions of veterans, which you guys do, you have input into the process. Let me ask you this question. I don't know what the answer is. My understanding is that the Secretary kind of meets with representatives of the organizations fairly frequently, that he wants to hear your input. Is that true, Mr. Commander?
Yes, it is, Mr. Chairman. We have a sit-down breakfast with him approximately once a month.
Once a month.
To discuss the issues.
Okay. And I assume everybody thinks that that's a sensible idea, yes?
Yes, input from the veterans organizations, of course.
Right. Mr. Violante?
Yes, our executive director meets with both the secretary and the undersecretaries on a regular basis.
Mr. Tarantino?
That is not true for us. We had our first meeting with the secretary at the VA headquarters last week, and that was the first time since he was
Okay, so you have not been meeting on a regular basis?
No.
Okay. Mr. Blake?
Our situation is the same as the DAV. Our executive director meets with them on a monthly basis.
Mr. Robinson?
Yes, we meet with the secretary on a regular basis.
Mr. Gallucci?
We meet with the secretary.
Mr. Gallucci,
I'm sorry.
first.
Thank you, Mr. Chairman. The VFW's executive leadership does meet with the secretary on a regular basis, and our frontline leaders meet with his deputies on a regular basis as well.
Okay. Mr. Weidman?
It is on a regular basis at the national level. Where it's not on a basis is programmatic things. The only place in VA that is sticking to the President's executive order on consultation of stakeholders before decisions are made is the Undersecretary for Benefits, because it doesn't happen in many other areas, and if it did, the decisions would be better.
Mr. Isaacson, I have gone way over my time. You will have equal time.
Thank you, Mr. Chairman. That's the prerogative of the chair, too, I might add. So I'm happy.
But it's going to be the prerogative of the acting ranking member. You'll have that time.
Following up on the tone of the discussion, it needs to be, I'm going to make a statement. I'd like each one of you to tell me whether you agree with this statement or not. The question before us today is not the quality of health care delivered to veterans by the VA. The question is access to the quality of care. Would you agree with that, Commander?
Senator, we do agree with that, but there are also pockets within it, like a cancer, like a skin cancer. If you get the small pockets out, the overall system will live. But eventually, if you don't take care of that, the system will die.
Okay. Mr. Valente?
Yes, DAV certainly agrees with that, and I'd like to point out a task force back in 2003 that President Bush established to look at health care, pointed out at that time that there was a mismatch of funding and demand, and if something wasn't done about that, access was going to be affected, and that's what we're seeing now.
That's going to be my next point, but go ahead, Mr. Tarantino.
We would agree with that statement, Senator.
Mr. Blake?
Yes, sir, Senator. It's definitely access.
Mr. Robinson?
Our concern certainly would be the access, especially in rural areas.
Right. Mr. Gallucci?
Senator Isaacson, we would agree with that, but with access, that can leach into care delivery. One of the concerns that we received from a veteran in Nevada was that he was diagnosed with skin cancer, proper diagnosis, but because a dermatologist had left the VA Medical Center, they weren't going to be able to schedule him for a proper consultation until that person was replaced.
Which is somewhat an access problem in and of itself.
It is an access problem, but that's where access leaches into the quality of care that can be delivered.
Well, that's capacity is one of the problems for access.
Exactly.
Mr. Wyman?
It is primarily access, and an additional thing is that VA still is not systematically in the medical system addressing the wounds, maladies, and injuries of war and taking a military history and using it in the diagnosis and treatment modalities.
The reason I'm taking this track is I don't want us to leave this hearing with a mixed message. If there's any problem with VA quality of health care, we need to talk about that. But if there's not, except for isolated cases, and the dermatology case is a good one, we need to talk about what is the problem, which is access to that health care, which is a capacity problem, number one. But it also appears to be an attitudinal problem within the VA, where there's more of a motivation to make the numbers look good than give access to the care to make the veteran well. Am I stating it fairly? Anybody disagree with that statement?
No, Senator, I think you're right. I mean, I think there's been concerns raised that maybe the performance accountability system promotes something like that, and so access is controlled in order to make performance look better.
And capacity is a function of appropriations, I understand that, but it's also a function of the management of the system internally within the VA. I don't ever recall, and I could be wrong, Mr. Chairman, us receiving a report from the Veterans Administration on any study it's done to improve its access to capacity, or improve its capacity so we improve access. What we always tend to talk about is time it takes to get a determination for a disability, or how long it takes to get into a VA center, or some other isolated case like that, when it seems like we ought to have a thorough examination of the capacity situation in terms of the VA. And then you got to take a look at the issues that you addressed, Mr. Blake. I know you're not for any private delivery of service. You want the veterans hospitals to operate, and I know, Commander, that's the same you do. But the option of having that access could help solve the capacity problem, particularly on a selected specialty like dermatology, like melanoma, like Mohs surgery or something like that. So is that an idea that's not replacing the VA healthcare system, but having veterans have options to access the private healthcare system? Would that work, Mr. Blake?
Senator, I think veterans have options even now, and I think they're improving on it. The PCCC is an example of how they're trying to improve upon that. We certainly believe that if they're going to move some in that direction, there needs to be coordinated care. My point was that doesn't particularly work, though, for veterans with specialized care needs, like SCI or blinded care or amputation, because those types of services don't really exist in the private sector, at least not in the way that our members have come to expect it. But we certainly could see where, privatized care plays a role in, or contracted for services with coordinated care plays a role. One thing I would suggest, though, is that as a solution suggests that that's what veterans want. But I think some of the problem that we see right now shows that veterans want into the VA. So why would we create an option where they necessarily where they would go somewhere else? They want into the VA. They can't get into the VA. So we're not sure that allowing them to go outside is addressing what their immediate desire is.
Except that wants and needs are two different things, and the need is the most important, and if it gets them the service they need in a timely fashion, even though it might not be in a VA hospital because of the particular problem, it's better than having them wait so long they have a life-threatening condition come about.
I would agree with that point, Senator.
And I appreciate all of your testimony was outstanding, by the way. I appreciate all of it very much. And I'm going to leave this hearing with a clear message for the veterans of Georgia. We need to solve the access and the scheduling problem, and we need to do it now. And we need to assist, the VA needs to go internally, and Secretary Shinseki and I talked about this, and have an accountability mechanism all the way down, because I think the senior leadership is disserving the American veteran. I think we've known what the problems are for some period of time, and I think we know what the needs are, and I hope we'll take this hearing to move forward and solve those problems, hold everybody that's accountable, and have an attitude towards solving problems rather than masking problems. Thank you, Mr. Chairman.
Thank you, Senator Isaacson. Senator Begich, I think, is next.
Mr. Chairman, thank you. I'm going to follow up on Senator Isaacson's comments. We had a similar problem, and I'll just kind of put this on, and I first want to thank many of you because you had concerns about what I'm about to talk about, but you came, and Carl, you're one of them, but you were really good in helping us figure this out, and that is, we have a huge Alaska Native population, American Indian population in Alaska, 150,000+. We have an Indian Health Service system, which was not very good, to be frank, many, many years ago. And in Alaska, the tribes took it over and now deliver, we consider, the best health care in this country, in my opinion, and I think many others' opinion. Matter of fact, CMS has said it's some of the best health care in the country. And because we don't have a veterans hospital, and many of us had these conversations over the last few years, we were trying to figure out a system to create better care. Access is really what it's about. If you live in Nome, Alaska, and you're want to come into Anchorage to the clinic, you could spend $1,500, $2,000 from one of the villages going to Nome, then coming to, very expensive for our veterans. We have 800 veterans living in Nome, Alaska that are both Native and non-Native. Built a brand new hospital there with stimulus money, which I'm very proud of, a $170 million facility for Indian Health Services, which is actually run by our tribal consortium. Indian Health Services does not run health care in Alaska. It is given a check to the tribal consortium, who then delivers health care for our tribes. Because of the work you all did with our office, we now have access to our veterans. Those 800 veterans have a choice now. They can go to Indian Health Care Services, get that health care anywhere near their home, their village. I can tell you story after story that has now come to very valuable. Or they can go to the clinic or go to Seattle to the hospital. Because it was an access issue. Because the care that the VA offers, and I think you all said it, we have great professionals there. They work hard. I think they're overworked for the amount of time they have. There's not enough staffing. Now, we can go through all those lists. But the issue was we found a solution protecting the importance of VA healthcare, which is veterans want to be part of the VA healthcare system. They want to be, that's their, they earned it, they fought for it, it's a benefit of theirs. But in Alaska, we had an access issue. We could not afford to have a veteran sitting out in rural Alaska waiting to catch the next plane when there's a hospital right next door. So we figured this out. And we have a model called NUCA, which when you walk into the Indian Health Care Services, the odds of you getting a same-day appointment is probably 75% or better. And when you come in, the question you brought up is the amount of ailments that someone comes in with is different than the model that the VA has been designed from many years ago. NUCA model, same situation, problem. Too many ailments, one individual. So now when you come in, you get a mental health provider, eye doctor, dentist, full health care. They meet with you as a team. So they resolve the issues collectively rather than individually. And the care quality is superb. You know, we've been pushing on the VA to look at the NUCA model because that's how we got to deal with multiple ailments of an individual. And also same-day access. To be able to schedule a routine appointment and have to wait weeks or months is outrageous. And so, you know, maybe it's more of a statement, but I'd be interested, and again, I know many of you worked with us. I point Carl out because he and I had some good debates on this. But I think it's working. I have veterans now who call me and tell me thank you. Not that they are not going to always go to the VA, they're going to go to the VA, but now in a situation they're living in a village or a small community, they can go across the street and there it is, they have a choice. So I guess I'd like you've heard kind of my comments here, I'd be interested in any comments folks have. And again, the NUCA model, that's what it's called, NUKA, is a very unique delivery system. It's all about access. Any comments from folks?
Senator, Dan Dellinger. Thank you for that question because it just so happens I was in Alaska last month and I was in Kenai and they
beautiful new hospital down there.
And they want to expand what they're doing in that area and they're in a strip mall with the CBOC there.
That's right.
But they also are looking for additional space. And VA spent 3 years trying to get a lease worked up and they're frustrated. They want to do additional things. But I agree with your assessment as far as accessibility, especially out west. East Coast is something different, but as I travel through the western states, I see more Indian services. Exactly. And I think it's something we should build upon.
Kenai has a brand new, it's called Kenaitze Tribe Hospital. Beautiful hospital that will partner actually with that CBOC.
Exactly.
Which is unbelievable care. Thank you for that. Any other comments on that? I know my time's almost up here, so.
The only thing I would like to say, Senator, is right now we have 27 points of access that are on hold because we can't get the funding. And that's important that we move forward on that. I mean, going back to the Clinton administration, when they put a lot of construction on hold under CARES to determine where they wanted to build, I mean, VA's been underfunded in construction since the Clinton administration. So we need to do something about that also.
Thank you, Mr. Chairman.
Thank you, Senator Begich. Senator Moran.
Mr. Chairman, thank you very much. And Secretary Shinseki, thank you for remaining for the testimony. I appreciate you being here. Let me raise a topic about the assessment that's now going on, the face-to-face review across our country. One of my congressional colleagues had a conversation with VA personnel in Jackson, Mississippi after the assessment presumably took place. And this is a bit of a paraphrase of his or her report back from what they heard about this assessment. We asked about their face-to-face review. They stated that the team came in on Monday, interviewed some clerks and some supervisors, and they didn't find any evidence of scheduling issues. No veterans were interviewed. What struck this person was the apparent superficiality of this so-called audit. A day at most visit that did not comb through the electronic system or actually audit any reports is not indicative of a thorough review. That's what I tried to raise in my opening statement is we're going to have one more review that is to be completed within 2 weeks. We have 1,700 facilities across the country. And so in part my concern is the quality of the review. It appears to me that this is more of damage control. It's what people do when there's allegations of mismanagement, improper conduct. You have another review. And so my concern is how credible will the review be based upon the amount of time and resources that's being devoted to it. But perhaps more troubling to me is how many reports, allegations, IG, GAO, congressional hearings do we have to have before there is a different approach or attitude at the VA to solve the problem? And so I don't disagree with an audit across the country, but what is this really going to accomplish? Will we be here 6 months from now in which the VA has a plan in place to transform itself so that these access issues that you all described are not the same ones that we heard today, we heard last week, we heard last month, we heard last year? The Phoenix situation seems to have brought national attention to this problem. But I can't imagine that there is anyone at the table who believes that the Phoenix situation is really what is the problem. It's a symptom of a much broader problem that has been ignored for a long time. So, Commander, and here let me add this. I understand that the testimony of the Secretary this morning in response to the Senator from North Carolina, in which he outlined, the Senator, outlined a long list of audits and reviews, GAO reports, Inspector General audits, and the Secretary indicated that he was unaware of those audits and reports and therefore hadn't been used in any conclusions that I assume would be made at the VA. There was an IG report that's included in that list that said the unexpected death report could be avoided if the VA focused on its core mission to deliver quality health care. Because no two VA medical centers are alike, it is difficult to implement VHA directives when there are no standard position descriptions or organizational structures. The IG believes it's time to review the organizational structure and business rules of VHA. How can that be an IG report that a Secretary of Veterans Affairs would be unaware of? It's directly related to the management, the organization of the Department of Veterans Affairs. And so my question, if there is one in here in my commentary, is what assurance can we have, or what assurance do you have, that when this face-to-face review is done, that something will be different in the direction that the VA is taking in regard to creating higher quality care for veterans and making certain that they have access? Commander?
Senator, that's quite a task. With the IG audit, yes. In the findings, once they come out, I think this committee needs to establish, along with VA, milestones to rectify these issues as they go through. But as you noted in your report, each hospital is different. And even when a director changes, a hospital was doing excellent, then could possibly slip below the standard. And so it's going to be an ongoing challenge. And we would hope that the Secretary and the VA would move forward as soon as possible with the changes necessary to give us the quality health care that all veterans deserve.
My time is soon to expire, and I don't know whether the Chairman is intending to allow you to answer my question, but I would add that you all, almost all, indicated that you have, or your senior staff have, ongoing conversations with the Secretary or high-level individuals at the Department of Veterans Affairs. But the question that I would ask is, does that result in a change, an approach, style, management, attitude at the VA that actually results in higher quality care for our veterans? Mr. Chairman, thank you for the opportunity to issue a statement and to ask the questions.
Thank you, Senator Moran. Senator Testa.
Thank you, Mr. Chairman. I want to thank the panel for their testimony, their perspective, and their vision. I also want to thank Secretary Shinseki for staying here for this part of the hearing and express my apologies. I got tied up in a banking committee and votes on the floor, but we will follow up with you in private. It's good to be asking questions about fifth or sixth down the list, because I think we've all agreed that access is the issue. It is the issue. And we've had everything talked about, from dollars to allocation to construction to milestones to manpower to all sorts of stuff, and it all is good. And it all is helpful. I'm going to ask you, each one of you folks, because you represent veterans in this country that are being served by the VA. I think you have an understanding of what the challenges are out there. So
you're not Secretary of the VA, you're not President of the United States, you're above all them. You tell me what you'd do first to fix the VA and what you'd do second. And I'm assuming there'll be 3 or 4 or 5 more down the line. But is it money? Is it the resources they have need to be allocated different? Is it we need to put a focus on hiring professionals? And you can't say do all of them because we want to hold folks accountable. So if you could give me your priorities for what we need to do, I think it could be helpful.
Senator, assessment, I think, is the first thing that needs to happen, because as we've heard the VA speak about they have enough money, but they don't have the accurate numbers. If they're gaming the system, how many actual visits are they going to have a year? Instead of having, 85 million, is it going to be 150 million? So you can't assess a money value to that until you can make the assessment as to what exactly the problem is.
Okay, and so then I assume that once you get the assessment, you follow that assessment as a blueprint to fixing the VA. Does anybody else have anything they'd like to add to that? Go ahead, Mr. Galucci.
Senator, thank you for asking that question. I actually have a list of 4 things that I would really want to talk about. First is resources, as the VFW and our independent budget partners have talked about. And it may not be a numbers game, it may be allocation of resources.
So what are you telling us to do?
Well, we would recommend taking the IB's recommendations on how to properly fund VA and things like capital infrastructure and VHA's baseline budget. Second would be training and outreach for your gatekeepers, the people who man the call centers at VA facilities.
Okay.
And outreach to veterans so they know what to expect when they call VA.
Okay.
Consistency across the board so that your experience at one VA center is very similar to your experience at another VA center. And finally, one that I've been chomping at the bit to talk about is accountability. We've had a lot of talk about accountability. The Secretary said that 3,000 employees were sanctioned in some way, whether that was termination, retirement, or transfer, demotion, what have you. There's a problem in having conversations over recent weeks about this internally with VFW, with some of our advocates and veterans. There are 2 things that we know. First of all, reprimanding or firing an employee in the federal government is a difficult legal process with significant EEO and other legal protections. It can take a long time to take punitive action against an employee. Second, when there's a vacancy in the federal government, this is again not VA exclusive, it can take between 6 months and a year to fill that. So if you have an underperforming employee, you have to then make, and I'm really asking the question here, do you make the trade-off decision? So I have an underperforming employee, is it better to keep them on the books, at least serving some veterans, or terminating them and having that vacuum of care for 6 months to a year, or possibly longer?
I appreciate that, and that might, Mr. Chairman, bring us around to another discussion about how we can work with the department. And by the way, this could apply to all agencies in government, to reduce the red tape for hiring, because it takes far too long to get that done. I want to just ask a little bit about the accountability portion, because accountability is really, from my perspective, really easy to talk about, but sometimes very difficult to put your finger on where the problem is, who is the problem, and quite frankly, how you deal with it. Any ideas on I mean, for example, the argument could be made that because we've hired all these middle management folks, and I think you guys made a very good point on that. This is crazy. We shouldn't be doing that. These should be on-the-ground folks. But we've hired these middle management folks to make sure the folks on the ground are actually doing the job. Now, how do you deal with accountability? Do you contract it out? The oversight? What do you do? Or does it strictly fall at the Secretary's feet and everybody else is held harmless? Go ahead, Mr. Whedon.
I think that the bill introduced by Mr. Miller on the House side is a good start. And people said, do you favor that bill which strips SES people at the VA of any protections whatsoever? But there's a reasonable point in between Mr. Miller's bill as it currently is and what we have now. Because they can't fire SES people. They say they can, but they can't. I mean, I remember the lady from Kansas City a few years ago. They removed her as a visiting director, but every Monday morning flew her to Washington, kept her here at government expense, and flew her back for 3 years, paying her $180,000. So they need flexibility.
Thank you. Thank you, Mr. Chairman.
Thank you, Senator Testa. Senator Johans.
Thank you, Mr. Chairman, and to everybody who is here, this has been extremely helpful. I think we're going to find that the access issue, which you all consistently say is the problem, is going to be easier to identify than to solve. You know, I think about, let's say a VA hospital needs 5 specialists. They're probably going to recruit from the area around, and they're going to compete with private doctors' practices. They're going to compete with hospitals, non. And that's true whether it's the doctor or the nurse or the medical technician, whatever it is. So building that capacity, even with lots of money, would be a challenge. And I think we all agree to that. So let me ask you a question, because I also agree, we're waiting for a hospital in Omaha. I'm beginning to wonder if it will happen during my lifetime. And I'm a fairly young man. I'm, you know, not too old. And even if we could get all the money all at once, which would be very hard to accomplish, how much construction can you get up and going and on and on? So let me ask you a question about access. Let's say that we're thinking about this and we've got all of this population that is needing more access, not less. It's us Vietnam-era people, it's a whole group of people, and we're aging. We're the baby boomers, and we need more access, not less. Would your members be open to an idea that said something like this? They call, they say, I need to see a healthcare professional because I've got a spot on my leg that doesn't look right. I think it might be cancer. And they say, well, we want to see you just as quick as we can, but that'll be 4 months or 6 months or whatever. Would your members be open to an idea that says, look, if you can't get in within 2 weeks or 3 weeks or whatever the appropriate timeline is, you can seek private care. You can go to your local doctor or a specialist or whatever. The government will pay the cost of that. And we will cover that because we don't want you to wait. And we believe that that is the best way to deal with access, the quickest way, the most effective way. And the other thing I'd mention in asking you this question is in states like mine, we're a western state, the state of Nebraska, access for rural veterans is especially difficult, and it's especially difficult in some areas like mental health and specialized care. Commander, what's your thought about that?
Well, you know, the VA right now utilizes telemedicine. So if they're at a CBOC, and even though there's only a nurse there, they can, by utilizing a telehealth, can be to that hospital.
Yeah, I appreciate that, but how would your members react if I said, look, we're just not going to make you wait anymore. If the VA can't meet your needs within a certain period of time, then we will allow you, if you choose, to seek private care. If you want to wait, it's a free country. You can wait too.
I understand it. We wouldn't be opposed to that because we want the best health care fast as possible, but we also have to put a caveat on that it can't happen exceedingly because then there goes the entire budget as fee-based, which is going to be higher in the private sector versus the ability in the VA.
Well, I get that, but we're all saying we want the best care. Yes.
Then, I mean, that's the exact point, though, is if you're not willing to give VA the resources it needs to allow for access in the facility, you're going to need to give them more resources by sending veterans out to the community. Now, VA has the authority. I don't think they use it enough for purchase care. And again, as I pointed out, if a veteran can't be seen in a certain time frame, they should be able to get that care by a private doctor, but VA needs to coordinate that care But we need to be careful that we don't start increasing the money going out to private doctors and taking away from VA's ability to hire internally, because all we're doing is robbing Peter to pay Paul, and if they don't have the money to do it now, they're going to have less money to do it on the private sector.
I'm out of time on a complex issue, but here's my point again. If it results in better care, isn't that what we're trying to achieve? And boy, I hope someday I can have a discussion with all of you. Thank you, Mr. Chairman.
Senator, could I address that real quick?
Sure.
It's my understanding that the PCCC, which is Patient-Centered Coordinated Care, is sort of envisioned to address part of what the problem is that you outlined specifically. And that's what we want. We want coordinated care because the key is the continuity of care and ensuring that the VA is ultimately responsible for that veteran so they know the spectrum of what that veteran is receiving. So I think maybe PCCC is moving in the direction of addressing the kind of concerns that you're raising.
Thank you, Mr. Chairman.
Thank you. Senator Blumenthal.
Thank you, Mr. Chairman. I want to thank all of the leaders who are here today for your presence today, but also your tireless and relentless work on behalf of the veterans of America. And truly, your leadership has made a big difference, not only in the performance and outcomes from the Veterans Administration, but in countless communities and other areas across the country. So my thanks to you, and my questions are very simple. All of you, I believe, would agree with me that the investigation should be as hard-hitting, aggressive, thorough, and prompt as possible, and that if that requires the resources of other investigative agencies, they ought to be called upon as well. Would you agree?
I do, sir. Yes. Senator.
And second,
we not only agree, but our national president, John Rowan, wrote to the Attorney General of Arizona last week and to the U.S. Attorney for the District of Arizona, asking each of them to launch criminal investigations into reckless endangerment, possibly resulting in loss of life.
Well, if you were not here earlier, let me just tell you that I urge that the Secretary of the VA, Secretary Shinseki, strongly consider. In fact, I recommended that he involve the Department of Justice because there is ample evidence, and I emphasize evidence, not just allegations of criminal wrongdoing, including destruction of documents and falsification of statements, to warrant the FBI to review this situation, as they do commonly when there are allegations of this kind, and determine, in fact, whether there is a basis for that investigation. And the reason is quite simply not only the evidence of possible criminal wrongdoing, but also the Inspector General lacks the jurisdiction and authority, the resources, and the expertise to do a prompt and effective criminal investigation. Only the FBI can provide the resources, expertise, and authority. And the Department of Justice includes the U.S. Attorney in Arizona and every U.S. Attorney in every state that may be affected here. So I think what we share is a determination, and I believe that the Secretary of the VA shares it as well, to get to the bottom, to remedy the wrongdoing, to provide relief to anyone denied access, and I think that is a determination that unites us in this room, and that accountability means changing the team if necessary at the VA, and I believe that that there may at some point be a need to consider those changes as well. So again, my thanks for being here. My time is limited. I thank the chairman.
Thank you very much, Senator Blumenthal. Senator Hirono.
Thank you very much. I do apologize if this question has already been asked, but Senator Murray had asked earlier of, I believe, Secretary Shinseki as to what a face-to-face audit should involve. And I'd like to ask you, and perhaps we can start with Mr. Bellinger, what needs to happen in a face-to-face audit to truly elicit the kind of information we need to address the challenges and the problems at VA hospitals and clinics?
Thank you, Senator, for that question. I feel it has to start with IT first. They have to look at the process of the books as far as what actually occurs there. Then they also have to go through the administration, through the physicians and also the employees, but also get input from the stakeholders in this, also the veterans.
Did that happen the last time? Apparently there have been audits before, and when those audits were conducted, were the stakeholders, i.e. the veterans organizations, included?
I do not have that information.
Do the rest of you have any information along that will help us? Yes.
Often we are not included, and actually even more important than the organizations at the local level is to talk to veterans at the local level who are not handpicked and say, what's happening here? If you ask the vets, they're smart, we got hurt, we got wounded, we didn't get it done. And the vets will tell you how to fix the facility.
So would you all agree that any face-to-face audit should include, probably this is a rhetorical question, but input from the veterans organizations as well as veterans at the particular facility?
Senator, I would agree with that. I would also, as we pointed out in our testimony, recommend that there be an independent third-party expert involved. It would alleviate a lot of the questions that Senator Moran raised about the audit, and I think it would help everyone be assured that these audits were being done properly and everything was being looked at.
What do you mean by an independent third-party entity?
Someone who's I mean, I don't have the
Like
expertise.
whom?
I don't have the expertise to determine, you know, are the people cooking the books, are the veterans getting timely care? Are they spending sufficient time or too much time with the doctor? There needs to be someone who is an expert in time management and in accessing medical care that can be there to make a determination, are they asking the right questions and are the answers sufficient to address this problem?
Senator, I would suggest also, you know, if they're going to do a thorough audit, it would take more than a couple weeks, certainly, because a thorough audit would be an examination of what the entire capacity of the system currently is. That might involve clinicians, nurses, whatever it may be. I will suggest that if the audit that's going on right now is what Senator Moran suggested is happening, that's pretty damn disheartening, because that's not going to solve any problems as far as we're concerned. It's going to take a more thorough analysis for sure than a couple of hours out of one day in a week to sit down and figure out what's happening. It might get to the bottom of a problem, a shallow depth problem at a local facility, but I'm not sure that's going to solve the deeper rooted problems.
I would envision that any kind of an assessment of the entire VA healthcare system would involve not just this process that Secretary Shinseki has described to us, but that it will be an ongoing kind of an assessment. I hope that that will be the case, and the Secretary is still here, and I'm sure that he's taking to heart the suggestions and comments that you're now providing. I had asked the Secretary, in view of all that we are asking of the Veterans Administration with regard to education issues, housing issues, homelessness, all of that, whether you think that this is taking away from the VA's core mission of providing health care for the veterans. Anybody care to respond to that?
There is no such thing as a homeless veteran. There are veterans whose problems have become so acute and haven't been addressed that they've ended up without a home. And so it's not a whole different class of veterans, if you will. Mm-hmm. And if the other services come through, then people do not end up on the street. And each one is a failure. Doesn't mean that people set out to fail, but somehow we've failed those folks coming home.
And Senator, I would like to add on to that, the VFW believes that the resources and services that VA can provide should never come at a trade-off. VA's obligation is to provide holistic services to the veteran that can come in the form of education benefits, employment assistance like the resource that they launched a couple of weeks ago through e-benefits, but also healthcare has to remain a cornerstone of that. when veterans transition off of active duty, there are a litany of transitional resources that need to be made available to them. VA has the primary mission in delivering most of those, except for possibly what Department of Labor, Veterans Employment and Training Service has. So we would never want to see trade-offs made on how we deliver other benefits, because if we start injecting resources into healthcare, will GI Bill administration suffer, or will other benefits administration suffer?
Thank you for that perspective. Thank you, Mr. Chairman.
Senator Burr.
Mr. Chairman, just 1 second, because in my absence, Senator Moran did talk specifically about the audits, and he read a statement. I just wanted the witnesses to know that was the assessment of Chairman Miller from the House Committee. He's actually was at Jackson, and I'm not sure how many facilities he's covering, but that was his assessment of the audit process. Not that I don't love you guys, but we're going to try to get the next panel in before we get into a series of votes that will bring a finality to this, so thank you.
Thank you, Senator Burr. All right, let me just say this. First of all, thank you for what you do every day representing veterans. Thanks for being here. But most importantly, I think we all know that we're not going to create the great healthcare system we need in the VA without your active participation. We need you. So thank you very much for being here, and keep up the good work. And if we can bring up the third panel. Okay, let me introduce our third panel of the day. Representing the VA's Independent Inspector General's Office is its Acting Inspector General, Richard Griffin, and he is accompanied by Dr. John D. Zadeh, Assistant Inspector General for Healthcare Inspections. From the National Association of State Directors of Veterans Affairs, we have its president, retired Rear Admiral W. Clyde Marsh. From the Government Accountability Office, the GAO, we have their Director of Healthcare, Deborah Draper. And finally, joining us today is Philip Longman, Senior Research Fellow at the New America Foundation. Thank you all very much for being here. Mr. Griffin, you may begin.
Mr. Chairman, Ranking Member Burr, and members of the committee, thank you for the opportunity to provide testimony at this hearing. I would like to provide an overview of our ongoing review at the Phoenix healthcare system. The OIG has assembled a multidisciplinary team comprised of auditors, healthcare inspectors, board-certified physicians, and criminal investigators from across the country to address these allegations. I've directed our team to focus on two questions. Number one, whether the facility's electronic wait list purposely omitted the names of veterans waiting for care, and if so, at whose direction. And number two, whether the deaths of any of these veterans were related to delays in care. To get to the bottom of these allegations, the OIG has an exhaustive review underway that includes 7 components. Number one, interviewing staff with direct knowledge of patient scheduling practices and policies, including scheduling clerks, supervisors, patient care providers, management staff, and whistleblowers who have stepped forward to report allegations of wrongdoing. Number two, collecting and analyzing voluminous reports and documents from VHA information technology systems related to patient scheduling and enrollment. Number three, reviewing medical records of patients whose deaths may be related to delays in care. Number 4, reviewing performance ratings and awards of senior facility staff. Number 5, reviewing past and newly received complaints to the OIG hotline on delays in care, as well as those complaints shared with us by members of Congress and by the media. Number 6, reviewing other prior reports relevant to these allegations, including administrative boards of investigations or reports from Veteran Health Administration Office of the Medical Inspector. And finally, number 7, reviewing massive amounts of email and other documentation pertinent to this review. To facilitate our work on May 1st, I asked Secretary Shinseki to place the Phoenix Director, Associate Director, and another individual on administrative leave. This was done because of the gravity of the allegations and to ensure cooperation by Phoenix staff, some of whom expressed concern about talking to the OIG team. Secretary Shinseki immediately agreed to my request. I'm confident that we have the resources and talent to complete a thorough review of these allegations at Phoenix. We are using our top audit experts who have reviewed VA scheduling over the years to examine all of the scheduling-related records. Dr. Day's board-certified physicians from our Office of Healthcare Inspections will be reviewing medical records, treatment, and harm that may have resulted from delays in care. OIG criminal investigators, including IT forensic experts, are also assisting the team. We are working with federal prosecutors from the United States Attorney's Office for the District of Arizona and the Public Integrity Section of the Department of Justice here in Washington, so that we can determine any conduct that we discover that merits criminal prosecution. Since the Phoenix story broke in the national media, we have received additional reports of manipulated waiting times at other VHA facilities, either through the OIG hotline, members of Congress, and the media. In response, we have opened simultaneous reviews at several other VHA facilities. These reviews are being conducted by other OIG staff to enable the team working on the Phoenix review to complete their efforts on that project. We expect that these reviews will give us insight into the extent to which these scheduling issues are present at other VHA facilities. My staff is working diligently to determine the facts of what happened at Phoenix and who is accountable. While much has been done, much more remains ahead. Be assured, however, this review is the OIG's top priority and that maximum resources dedicated to bring about its timely conclusion. We intend to brief you and other members of the Congress once we have reached final findings of facts and are ready to publish our report. We project finishing the project and publishing our report in August of this year. Thanks again for holding this hearing, and Dr. Day and I will be pleased to answer any questions.
Thank you very much, Mr. Griffin. Admiral Marsh.
Chairman Sanders, Ranking Member Burr, and distinguished members of the committee, my name's Clyde Marsh, and I'm the president of the National Association of State Directors of Veterans Affairs. I'm honored to present the views of the state directors from all 50 states, the District of Columbia, and 5 territories. As state governmental agencies, we are charged with the duties to include assisting the processing of claims for disability compensation and pension, burial services in our state veteran cemeteries, survivor benefits, coordinate access to health care, and provide over half of all VA authorized long-term care in our state nursing homes. From the NASRA perspective, the state of VA healthcare is strong. The VA has medical centers located in the majority of major cities in America. The VA has expanded their community-based outpatient clinics in recent years to many of the smaller cities and rural areas in our states. VHA has moved out of the box, taking advantage of technology to provide telehealth, telemedicine, and rural consults in the rural areas. They have also taken steps to provide transportation for those veterans in extremely rural areas to make their CBOC appointments. VA customer satisfaction has been trending higher in accordance with the American Consumer Satisfaction Index. VA may not get everything perfectly every time. However, on a national level, VA has and still is one of the leading healthcare providers in the country in providing good quality health care. Those of us in the health delivery business for VA, we constantly strive to get it right, and we work on that every single day. In our experience, VBA, VHA, and NCA are on the same page. NASRA does not endorse, nor do we agree with calling for Secretary Shinseki's resignation, along with his top VA administration officials. These leaders are crucial not only to continuing to transform our nation's second largest federal agency, but they will be needed to lead follow-on actions to swiftly address or correct any health care or procedural issues that may be identified. It is premature to point fingers or rush to judgment, and it certainly is not in the best interest of our nation's 22 million veterans to make premature decisions based on allegations before the IG investigations are concluded and the facts are determined. Under Secretary Shinseki's leadership, the U.S. Department of Veterans Affairs is transforming a pre-World War II antiquated claims process into a paperless claims system that has reduced compensation and pensions claims backlog by 44%, has reduced veterans' homelessness by 24%, and has enrolled more than 2 million veterans in the healthcare system since 2009, receiving some of the highest quality care ratings in decades. NASRA is committed to supporting VHA and caring for over 8 million veterans enrolled in the healthcare system. At the local level, state directors are in constant coordination with medical center directors concerning the delivery of health care. To assist VA, NASRA asks that the Senate gives full attention to confirming those individuals that have been nominated to fill VA key vacant leadership positions, that VA could then become fully manned. NASRA strongly emphasizes again that it is imperative that VA, and specifically VHA, receive the necessary support that is required to adequately care not only for the 8 million veterans enrolled today, but the anticipated 1 million more veterans over the next several years that will require medical assistance. And those folks will be coming as a result of the war and military drawdown. The bottom line is that VA may require more in terms of the budgets. They may need more doctors, nurses, technicians, clinicians, and possibly even facility expansions or operations. As the IG inspection results are made available, and VA implements corrective measures of improved procedures in VA healthcare system, NASRA looks forward to participating as co-partners or facilitators. In conclusion, NASRA can help veterans become more informed about their benefits as well as how to be enrolled and receive the care that they have earned and need. Mr. Chairman and distinguished members of the committee, State Directors of Veterans Affairs remain dedicated and committed to doing our part. We have the utmost confidence in Secretary Shinseki and firmly believe that he and his VA leaders will transform VA into a technology-based, more service-oriented, and veteran-friendly 21st century agency. Thank you for including NASRA in this very important hearing.
Admiral, thank you very much. We now have from the Government Accountability Office their Director of Healthcare, Deborah Draper.
Chairman Sanders, Ranking Member Burr, and members of the committee, I appreciate the opportunity today to discuss access to care problems in VA that may delay needed medical care for our nation's veterans. For over a decade, GAO and others, including VA's Inspector General, have reported that VA medical centers do not always provide timely care. In some cases, these delays have resulted in harm to veterans. Across our work on access to VA health care, several common themes have emerged. Weak and ambiguous policies and processes, which are often subject to interpretation, resulting in significant variation and confusion at the local level. Antiquated software systems that do not facilitate good practices, inadequate training, unclear staffing needs and staffing allocation priorities, and inadequate oversight that relies largely on facility self-certification and use of unreliable data for monitoring. In 2012, we reported that VA's wait times were unreliable because scheduling staff did not always correctly record the required appointment desired date, the date on which the veteran or provider wants the veteran to be seen. This is due in part to lack of clarity in the scheduling policy on how to determine and record the desired date, a situation made worse by the large number of staff who can schedule appointments, more than 50,000 people at the time of our review. During our site visits to 4 medical centers, we found that more than half of the schedulers we observed did not record the desired date correctly, which may have resulted in reported wait times shorter than what veterans actually experience. Some staff also told us they changed appointment desired dates so that the wait times aligned with VA's related performance goals. We also identified other problems in how the scheduling policy was implemented. For example, we found follow-up appointments being scheduled without ever talking to the veteran, who would then receive notification of their appointment through the mail. In addition, we found that the scheduling system's electronic wait list was not always used to track new patients, putting these patients at risk for delayed care or not receiving care at all. We also found that the completion of required training was not always done, although officials stressed its importance. Additionally, we found a number of other factors that negatively impacted the scheduling process. For example, officials described the VISTA software system used for scheduling as antiquated, cumbersome, and error-prone. We also found shortages and turnover of scheduling staff, provider staffing shortages, and high telephone call volumes without sufficient staff dedicated to answering these calls. We recommend that VA take actions to improve the reliability of its medical appointment wait time measures, ensure the consistent implementation of its scheduling policy, allocate scheduling resources based on needs, and improve telephone access for medical appointments. VA concurred with our recommendations and told us they are taking steps to address them. We are pleased that actions are being taken, but substantially more progress is needed to ensure timely access to care. We are currently conducting work examining VA's management of specialty care consults, which is a type of medical appointment. Our preliminary work has identified a number of problems, including delays in care or care not being provided at all at each of the 5 medical centers included in our review, unreliable specialty care consult data, and system-wide closure of 1.5 million consults older than 90 days with no documentation as to why they were closed. We expect to publish our findings related to this work this summer. As the demand for VA healthcare continues to escalate, it is imperative that VA addresses access to care problems. Since 2005, the number of patients served by VA has increased nearly 20%, and the number of annual outpatient medical appointments has increased by approximately 45%. In light of this, the failure of VA to address its access to care problems, including the accurate tracking and reporting of wait times and specialty care consults, will considerably worsen an already untenable situation. Mr. Chairman, this concludes my opening remarks. I'm happy to answer any questions.
Thank you very much, Ms. Draper. Philip Longman is the Senior Research Fellow at the New America Foundation. Ms. Longman, thanks so much for being with us.
Thank you, Chairman Sanders, and the other members of the committee for giving me this opportunity. I'm a little different from the other panelists you've heard today in that I'm not a veteran. I'm not affiliated with the VA in any way. I'm not affiliated with veteran service organizations. I'm here because I wrote a book, now in its 3rd edition, called Best Care Anywhere, Why VA Care Would Be Better for Everyone. I think the title pretty much speaks for itself, and I stick by it today. The inspiration for my book came from losing my wife, Robin, to breast cancer in 1999. And Robin was treated in one very prestigious corner of the American healthcare system right here in Washington, D.C. And suffice it to say that what I saw during the 6 months between her diagnosis and demise had caused me to radically become radically interested in the questions of medical quality and safety. Now, shortly after Robin died, the Institute of Medicine, instituted a report that has been alluded to here already today, showing that up to 98,000 people a year in the American healthcare system are killed by medical errors. That's equivalent to a jumbo jet falling out of the sky and killing everybody on board every third day. Goes in year out. More recently, the chairman has alluded to other estimates showing that as many as 250,000 people a year are killed by various forms of overtreatment, mistreatment, maltreatment, undertreatment in the American healthcare system, making contact with the U.S. healthcare system the third leading cause of death in the United States after all cancer and all heart disease. So I set out at some point to find out who's doing a better job. And I was very surprised to find, after reviewing the literature on healthcare quality and talking to many experts, talking to many veterans and such, that the VA healthcare system, by many, many metrics, outperforms the rest of the U.S. healthcare system as a whole. And proceedings today seems to have come to a broad consensus that VA healthcare in itself has exceptionally high quality. The problems we're dealing with here are access. So I won't really belabor the point. I will want to say, though, that I would have welcomed Robin being treated in a hospital that had an inspector general. Wouldn't that have been wonderful? Wouldn't it have been wonderful if there had been a committee of Congress, or maybe even 2 committees of Congress, that exercised oversight of that hospital? Wouldn't it have been great if there were various broad-based, effective citizens organizations akin to the American Legion that applied scrutiny to that corner of the American healthcare system? So we have to bear in mind, what the context here is. I also would want to draw attention to the fact that when we have a problem of someone gaming a metric on wait times or gaming some other metric that the VA applies, that's because there is a metric, right? I mean, in the rest of the healthcare system, by and large, there are no quality metrics that are exercised, let alone wait times. It took me 2.5 years to find a primary care physician in Northwest Washington who's still taking patients. Robin waited for a mammogram long enough for her tumor to grow from this size to this size, right? Many people in the United States today, most people in the United States, live in places where there are acute primary care shortages, right? We have a tremendous problem of access to begin with. My final point I'll just say, too, is that on the waiting times, right? So much of what we're doing is trying to determine whether somebody has a service-related disability or not, right? Is the reason you're losing your hearing because of the artillery fire that you heard in Vietnam, or because of all the Who concerts you went to in the 1960s? We have just a tremendous administrative machine, right, that adjudicates that kind of question. And that's where most of these veterans are getting ground down, waiting to get into the VA. How much smarter would it be if we just opened up the VA to all veterans and said, thank you for your service, come on in. Thank you very much.
Thank you very much, Mr. Longman. I thought all the testimony was excellent. Thank you all very much for that high-quality testimony. Mr. Griffin, a few questions. Thank you very much for plunging into this investigation, in a sense, in short notice. Briefly, let me reiterate, you and I have chatted on the phone. Do you have the necessary resources to undertake the kind of thorough investigation that needs to be done regarding Phoenix? Please use your mic.
Yes, we do. We have, under Dr. Day's direction, 120 medical clinicians who for a number of years have been doing reviews of VA medical centers. 1974 West Point graduate, 26 years as an Army doctor, and 10 years with us.
Okay.
The reason the IG system was set up the way it was is so that you'll have people who have knowledge of the department, and that's why we're the right group to do this review.
Let me ask you this. I think you have heard from almost all of the members here the desire, A, for you to do a thorough examination and investigation, but also to do it in a timely manner. Now, what you told us a few moments ago that you don't think you can do that till August. Is there any way that you can give us some preliminary information before that, maybe a preliminary report? Because I think many of the members would like to get a sense of what you have found out there.
As the review progresses, if there appears to be a seam where it would be appropriate for that to happen, we would do that. But remember, part of this review could lead to criminal charges being brought, and we don't want to do anything to jeopardize the ultimate outcome of the facts in the case.
Let me ask you this, and maybe it's premature, but if you could answer it, I would appreciate it. You know, what we've been reading in the media, and I just quote from one media report, quote, "At least 40 U.S. veterans died waiting for appointments at the Phoenix Veterans Affairs healthcare system, many of whom were placed on a secret waiting list," end of quote. At this particular point, can you tell us how many people you have identified who have died while waiting on a secret waiting list?
I can't give you that number because the number 40 that's been wildly quoted in the press does not represent the total number of veterans that we're looking at. That was one list that was created by the facility. We need to do an analysis of that list, both death records and VISTA records by Dr. Day's clinicians. But there are also other people who have come through the Congress, who have come through the media, who have come through our hotline. So we have multiple lists, none of them identical. We've begun to process on a preliminary basis of going through those lists. And the initial list that we were given, we have gone through, and there are only 17 names on that list. Our review to date, and we have more work to do on this because we want to have more than one set of eyes look at all of the records. But on those 17, we didn't conclude so far that the delay caused the death. It's one thing to be on a waiting list, and it's another thing to conclude that as a result of being on the waiting list, that's the cause of death, depending on what your illness might have been at the beginning.
So as of this point, the one list of 17 names that you have looked at has not at this point identified anybody who has died as a result of being on a waiting list and not getting...
That's right, for our initial review. And I want to ask Dr. Day to expand upon that so you can understand the nature of these lists.
This is complicated stuff. I do understand that. Dr. Day, did you want to add?
Well, sir, let me try. So we have been provided names of people who are on various lists. And it's true that those veterans whose names were on the list have died. We have looked at a substantial number of cases, and we have, in looking at those cases, determined that, yes, there was a delay in care frequently, as has been expressed. We have, in several cases, found that quality standards were not met. In a subset of that, we've found some patient harm. But to draw the conclusion between patient harm and death has so far been a tenuous connection. The records that we have looked at to date are mostly VA's medical records. So to the extent that a patient died, we're in the process of getting death certificates. autopsy reports. If they were in another hospital, then there are procedures we need to go through to get the rest of those records. We may need to interview people who are knowledgeable about the events surrounding the death. So it is a serious problem, and it's going to just take my staff a little time to work through that so that what we say we can stand by and that you're happy with the result.
Okay. Thank you very much. Senator Byrd.
Thank you, Mr. Chairman. Ms. Draper, in the GAO report regarding outpatient appointment and wait times and scheduling, the conclusion states, and I quote, unreliable wait time measurements has resulted in discrepancy between the positive wait time performance VA has reported and veterans' actual experience. Now, this VA report that you're talking about was the VA report that was presented to the VA in December of 2012.
That's correct.
It became a public document in January of 2013,
That's
correct? And what I've said so far about your comments on it are accurate, am I right?
That's correct.
Okay. In this report, GAO recommended, and I quote, the Secretary of VA direct the Undersecretary of Health to take actions to improve the reliability of wait time measures, and it went on to suggest, and I quote, the Secretary of the VA direct the Undersecretary of Health to take actions to ensure that VAMCs consistently and accurately implement VA's scheduling policy. That's accurate?
That's correct.
Ms. Draper, for the two recommendations, VA specified in their comments that these recommendations had a targeted completion date of November 1 of 2013. Let me ask you, based upon the knowledge that you have today, has this process at the VA been completed as it relates to those two actions in your report from December 2012?
It has not been fully completed.
And is this an ongoing conversation with VA about the completion of
It is.
those?
I mean, they've told us they've taken steps, and we provided that in our written testimony, the update on where they say the recommendations are. You know, to be quite frank, it's been almost a year and a half. We would have expected more progress to have been made.
Well, I think most of the members of this committee would probably say that they associate with that statement. Mr. Griffin, if I could, do you or your predecessor, and thank you for serving in an active capacity, and listen, you're a stand-up guy, and I just want you to know this member, and I think I can speak for all members, we've got great confidence in what you and your team will do, can produce, and the accuracy of it and the reliability of it, and I want you to understand that, and please share that with the folks that are working so hard.
Thank you, Mr. Bear.
Do you or did your predecessor have a regular scheduled meeting with the Secretary?
We have meetings with the entire leadership team every 2 weeks. My predecessor went to one, I went to the other one, and we've had occasional meetings with the Secretary at different times during the year.
So how many meetings have you had with the Secretary since the issue of Phoenix arose and you mobilized this IG review there?
Well, we had one meeting that was unconnected to the review. It was a budget-related meeting. And we had a second meeting when I went over to request that certain individuals be put on admin leave.
But from a standpoint of the actual investigation, the scope of it, all of that, who's handled that from a standpoint of?
During the course of the admin leave discussion, I gave an overview, not unsimilar to the 7 bullets that I mentioned here as to what we were going to be looking at. I would expect to be asked, you know, what's your basis for, you know, requesting that I put someone on admin leave? I think that was completely appropriate. But I think in the Secretary's words, we are independent, and we cannot be told to not do something or to do something because it would violate our independence.
I understand that. So when there's an IG report that completes, when Phoenix is finished, if it happens like every other IG report, will you or your staff physically sit down with the Secretary and brief him on the findings of that IG report?
Not on every report, certainly a report of this magnitude. We issue probably 300 reports a year.
And how many?
Not all of them would rise to the level, but we do At the Assistant Inspector General level, Dr. Day meets with the VHA senior staff on a recurring basis to discuss these things, and as we just heard about the process of getting closure on reports, there's an ongoing follow-up process that our personnel do until we're satisfied that they have taken corrective action.
How many years have you been in the VA at some capacity in the IG's office?
About 13 out of the last 16 years.
And how many times have you sat down with a secretary and briefed them on an IG report?
Oh, I would say a report of this magnitude, I would brief them on. Maybe a couple times a year, depending on, again, there are 300 reports. I would say maybe at most quarterly.
On a report or a multitude?
On a report, but the door is open. It's just the issues typically are resolved at the undersecretary level.
Have you ever requested a meeting with a secretary while you've been there and the meeting was not made available to you?
No.
Okay. I thank you, Mr. Chairman.
Thank you, Senator Burr. Senator Testa.
Yes, thank you, Mr. Chairman. I want to thank, as with this panel, I want to thank you for your testimony. Mr. Griffin, you said you have 120 medical investigators. Is there more investigators than that?
We have about 615 personnel in the IG organization. 120 of them work for David, and they're healthcare inspectors. They're doctors, they're nurses, they're psychiatrists, psychologists, clinicians.
How many people?
Therapy. We have about 150 criminal investigators. We have people in 39 cities around the country.
Gotcha.
We have over 200 auditors.
Let me cut to the chase.
Okay.
How many people are working on this investigation?
So far, 185 people have touched this investigation.
And you've been working on it for how many weeks so far?
This is the third week.
And if your testimony said you anticipate a final by August?
That's correct.
Do you anticipate a preliminary report before that?
To the extent that it will not impact the outcome of the work, to include the fact that we're working with two different groups from the Department of Justice looking at possible criminal violations.
Okay. I want to talk a little bit about senior management staff, including the Secretary and the VA. Have you, in this investigation, have you asked those folks for information?
No, we haven't.
Okay.
I mean,
Go ahead.
We did ask them for a list that they suggested to us that they had of veterans who died on an electronic list, but
let me put it this way.
Okay.
This is where I want to get to. Have they been open and transparent and, what's the other word I'm trying to think of, helpful in your investigation?
Yes, they have, and they have offered resources, but we don't want to give anyone the impression that our independence was being questioned, so we have not received any resources, nor do I intend to.
But as far as up to this point, being fully transparent with what you need when you ask, they deliver?
That's correct.
Okay. Has there been any, maybe you can say this, maybe you can't, if you can't, don't, but has there been any sign that, up to this point, that there's been two sets of books run on appointments?
I think that over the past 8 or 9 years, there are a list of reports that were mentioned earlier where we found that waiting times were not being accurately reported. Most recently on mental health, where it was reported at a 95% level, we looked at the exact same data and concluded it was 49%. So it's not a new issue, and I'm confident that when we finish our work in Phoenix, it'll be the same outcome as these previous reports.
Okay. That is all, Mr. Chairman. I would just say we look forward to the investigation. I know you need the time to do it right. Of course, in the society we live in, this case is already being litigated and convicted every day in the news media by some. And so it will be great to get the facts out there so that we can help the VA do their job better to serve the veterans who have served this country so well. Thank you all for being
Understood. And the only thing I can say about the rush is we are not going to rush to judgment at the sacrifice of quality. I know you're not suggesting that. We're going to nail this thing, and at the end, we'll have a good product for you.
Yeah, and at the sacrifice for people who are innocent. Thank you.
Sure.
Thank you. Senator Moran.
Mr. Chairman, I understand there's only a minute or so left in the vote that's been called, and so I'll try to summarize very quickly. Ms. Draper, and then I'll follow up with Mr. Griffin. The GAO reports, what is the process by which you have assurance that your report is acted on by the Department of Veterans Affairs? What's the follow-through, and what has been the results of GAO reports at the VA?
Yes, we for the report that we issued, it was publicly released in January of 2013. We did a follow-up with, they issue a 60-day letter on status of the recommendations, so we do have that. And then we provided congressional testimony for the House committee in April, so we followed up with VA to get an update on where the recommendations were. So we have periodic updates with VA on the status of the recommendations.
You testified earlier about this particular report and its current status. About other GA reports, do you have a sense that the VA is successful, useful, that your report is useful and they're successful in implementing the proposals that you suggest?
It varies. I think that we have quite a number of open recommendations at the VA at this time across GAO.
Mr. Griffin, in regard to the IG's report, how are you able to determine whether or not your report and its suggestions, its recommendations are followed through by the Department of Veterans Affairs?
Well, we do it in two different ways. In some instances, we will review, if we say you need a new policy on staffing, or you need a new policy on waiting times, or you need to train the schedulers, and you need to create a methodology where you can audit the scheduling process to make sure someone's not cooking the books. If they can satisfy us that here's the new policy and here's how we're going to make this work, we may close that at that time. More often, if we don't have a comfort level, we will send a team back 6 months later and go to the same facilities and look and see if the fixes are in place.
What's your sense in your time as acting, or if you have information about your predecessor, what's your sense of the Department of Veterans Affairs following the recommendations and implementing them following an IG report?
I think it's the answer is mixed. I think frequently policies emanate from Washington. The policies look good on paper, but they're not always followed by the managers in the field. So it's an accountability question for the field managers, and when they don't follow it, something needs to happen.
One of the things that I don't think you have anything to do with, but is an important component of an investigation of the Department of Veterans Affairs would be the Office of Medical Inspector reports. And one of the things that we've discovered is that those are not made public and not submitted to Congress. And so we don't know the results of those types of audits, investigations, or reviews. And I'm pursuing legislation to change that so we can see what that report says. We can excise the names and that keep the confidentiality of patients straight. But I think there's a whole set of other reports that there is no ability for us to gauge whether or not a recommendation is followed. Let me just ask in conclusion, Mr. Griffin, are there IG reports, let me say it this way, are there IG investigations ongoing that involve facilities in Kansas?
I would like to take that for the record. I know that we have, in the past week and a half, our criminal investigators who are located around the country have had a rapid response to 10 new allegations, And in a matter of 2 days over the previous weekend, they went to 50 medical centers unannounced in order to see if what was being alleged was occurring at those facilities. So
I'd be happy to know that. I actually was referring to more, not necessarily a current investigation beginning as a result of the current circumstance, but over the last year or so. And the reason I asked the question is that there have been allegations of incidents, circumstances, consequences at within the VA in my state, and our effort to find out what's going on, what response has the department taken as a result of at least this, these stories that are out there. We've never received a response from anyone at the Department of Veterans Affairs, either here in Washington with the Secretary and his testimony, or with Kansas officials, individuals who work at the VA within our state. And I did not know, do not know, whether or not any of those circumstances that are at least having a conversation are being investigated by you. And if you'd follow up with me, that'd be great.
I will. But the majority of our audit and healthcare reports go to the member whose district that facility is located in. Some of the criminal reports that take longer because of the judicial process and privacy issues involved with criminal cases, you may or may not see quickly.
Mr. Griffin, I apologize for interrupting you. I think there are 95 senators waiting for us to vote. This was a great panel, and I very much appreciate the wonderful testimony. Thank you all very much. The hearing is adjourned.